Welcome everybody to the Indiana Board of Veterinary Medicine January meeting. First order here is to introduce our board members that are present. Our newest board member, Dr. Kelly Peelman. I'm Dr. Paul Clementi, Dr. John Schnarr, Dr. Stephen Sunbury, and Natalie Goodwin is our representative from the public. So we do have a quorum, and we will next make a motion to adopt today's agenda.
So moved.
Second. All those in favor?
Aye.
Aye. Aye.
Aye.
Unanimous. And the next order of business is to adopt the minutes from the November 2nd, 2023 meeting. Does anybody have any changes to the minutes? Changes, additions?
There is something I'd like to point out. So I drafted these minutes and sent them to Dr. Rodenbarger because we had to have minutes that showed the adoption of the convictions of concern rule when I sent it to the Attorney General's office. He approved of the minutes, signed them, and I sent them on in November. So at this point, you can still review the minutes and amend them if you would like. Otherwise, I would just allow his signature to stand as the approved minutes.
Only thing I found, and I'm trying to find it right now, was just more of a typo type thing, nothing that affected the content.
Sure.
Makes sense.
Yeah. What page was it?
I had it marked and then I lost it and I had to reopen, and I'm trying to find it. It was just wording. It did not affect content
Okay. All right.
or context.
So do we need to vote to approve the minutes then? Or
Vote
do we
to,
want to do that next meeting?
maybe I would motion to, well, Clarence, I mean, Dr. Rodenbarg already approved the minutes, so do they even need to motion to approve the minutes again? I mean,
I just did it again. I think that's fine.
okay, all right.
Want to make a motion to adopt the minutes?
I move we adopt the minutes of the November meeting.
Second.
All those in favor of adopting the minutes from the past November 2nd meeting, say aye.
Aye.
All those opposed? The minutes are adopted. Next item on the agenda is board election of officers. Anybody interested in taking my job? Dr. Rodenbarger's job?
There are two positions, chairman and vice chairman. So maybe we do them one at a time.
All those in favor of Dr. Rodenbarger continuing as chairman of the board, I would make that motion.
I will second that motion.
All those in favor?
Aye.
Aye.
It's unanimous again.
Who was the second? Thank you.
Someone want to make a motion to fire me as the board liaison to the Attorney General? So,
I'll make a motion. We continue with you as the vice.
Second.
all those in favor of Dr. Clementi continuing as the board liaison to the Attorney General and as vice chairman, say aye.
Aye.
Aye. Okay, our next item on the agenda, I believe we're going to hear from Ann Kelly from the Veterinary Wellbeing Program. Is Ann here? Hey, Ann.
There. Do you mind?
Come on up.
Hi there. Thank you all for giving me the opportunity to speak. My name is Ann Kelly, and I am lucky enough to work with Lisa, who contracted me to help facilitate the Veterinary Wellbeing Program. And this program has been around for a very long time with the goal of providing therapeutic alternatives to discipline for veterinarians. Just to give you a little background about myself, I used to work at the Indiana State Medical Association in the Physician Assistance Program for 9 years, and I currently work at the Ohio Professionals Health Program and work with all licensees that provide health care in the state of Ohio. Again, trying to provide therapeutic alternatives to discipline. For the Indiana Wellbeing Program for veterinarians, we have 2 paths to entry. One is for voluntary folks. If someone, a veterinarian or someone in their office or family has some concerns, folks have access to my phone number. It is on every newsletter sent out by IVMA. Folks will give me a call. I'll do a screening, figure out what's kind of going on, and then direct traffic on where veterinarians can go to get fully assessed, to figure out what do we need to do so that you're healthy and well and safe to practice. And based on that evaluation, sometimes folks come right back to me, we sign an agreement, and maybe it's recommendations of individual counseling or family counseling or mutual self-help groups or seeing a psychiatrist, whatever those recommendations are, I incorporate into an agreement, and then I make sure that they're being done. If for some reason through that pathway, which knock on wood, this has not occurred, but if for some reason someone was deemed not safe to practice because they were not following those recommendations, at that point, I would let you all know. I have a release of information when somebody joins our program that I can let the veterinary board know if somebody's not safe to practice. So that's one bucket where folks come from. The other bucket is you all have kindly referred folks to me. When I get those referrals, I make calls, figure out what's happening, get an assessment done, and then based on that assessment, again, follow the recommendations. Sometimes those assessments say, hey, there is no issue, there is no need for monitoring. Sometimes it says, hey, listen, we need to have some kind of treatment. And again, we sign an agreement and move forward. I can tell you in the time that I've been working with veterinarians, it's been a true pleasure. I've seen folks have great success. In fact, I'm going to go do a presentation at Purdue next week about our program so that we are visible and making sure we're connecting with folks so they can be safe. So that's me in a little nutshell. What questions can I answer for you?
How many people do we have in the program right now?
2.
2.
And that is definitely down from when I first started.
Yeah, we've had as high as 10, I think.
So if someone is referred to have an assessment through the court system, would it still go through the wellness program, correct? Would it still refer the person for another assessment through the wellness program?
It depends what kind of assessment they
Okay.
had done, to be
Okay.
very honest with you. When I've got somebody that's taking care of patients, I want to make sure that they've had assessments done by licensed folks.
Right.
So locally speaking, in the Indianapolis area surrounding nearby, I would refer to a couple addictions trained psychiatrists in this area to have that assessment done. If the issues are fairly minor, if I've got someone that's had multiple DUIs or multiple clinical concerns, I would refer for a multi-day assessment. So based on the screening information, we can do stuff locally or do things in professional health programs that are accustomed to working with healthcare professionals, because this is a safety-sensitive occupation.
So when we refer someone and instruct them to get an evaluation by an addictionologist, you can coordinate that.
Absolutely. I do have people that I work with. And if it's not convenient to come to Indianapolis, I have colleagues in other parts of the state that I can call and say, who's an addiction trained psychiatrist or addictionologist that you train or that you feel comfortable with in your community.
So you can initiate that evaluation before they sign a contract with the program?
Yes. Yes. And in fact, I've had quite a few of those where the addictionologist has determined that there is no need for monitoring, there is no additional intervention, and I just write a letter so that you all are aware that this was done and that there's no further recommendation.
Because we make that recommendation fairly often for an evaluation. And as Laura said, sometimes I see in the court record that that's done in OWIs and DUIs, ordered by the court. And other times, there is no. Even from county to county, it's vastly different how they handle OWIs. We're finding that out.
Absolutely. And I can tell you, if somebody comes through our program, we are going to have them assessed by an addictions trained MD.
So we can refer them to you when they say, well, where do I start
Absolutely.
for the evaluation?
Yes.
Great.
And if they don't want to travel to Indianapolis, I will call colleagues in north part of the state, figure out if there's somebody there so that I don't have to have folks come to Indianapolis. But if I don't have somebody that is credible and accustomed to working with healthcare professionals, you're going to need to either make the trip to Indianapolis or to one of the professional programs that are accustomed to working with safety sensitive healthcare professionals.
Remind me, as far as the program itself, being involved, you said we have 2 currently. That is veterinarian only or not technician, correct?
Correct. It's
Okay, so
veterinarians.
okay.
Yes. And of those 2, one was a voluntary phone call and one was directed through you all.
And just to clarify, I'm sorry, I didn't mean specifically the 2 that are now, but it is only for veterinarians,
Yes,
correct?
it is only for.
Technicians,
Correct.
we can send them as far as to get screened or whatever, but they cannot become a part of that program, right?
Correct.
Okay.
Right. And certainly if a technician needs direction, I can send them and say, hey, call these folks.
Yeah.
These are the people you want to see.
Is that a contractual issue?
Yes.
That's what I thought.
IDMA pays for that.
Yeah, okay, thank you.
Is there any financial help offered at all?
I can tell you the veterinarians certainly do not pay as much as maybe a physician assistant or an anesthesia assistant through my practice. So the way it works, I let Lisa know who's in our program and she bills. And it is definitely a financially great arrangement for veterinarians because they're paying substantially less than if they did not have this contract. So Lisa did a great job.
What's the average length of the contracts that you've had in the past? Is
Typically 5 years.
5?
Yeah.
Because I hear 5 a lot.
Yes, and that's based on diagnosis. So if somebody is diagnosed with a substance use disorder, moderate to severe, that's going to be a 5-year contract. And that 5 years really has rolled out from early research done out of physicians, the Federation of State Physician Health Programs, and feel free to stop me if you don't want to know this. They started talking with all the different programs that work with physicians. They did some research, and one of the things that they found was when docs got good treatment, followed by chronic disease management over a period of 5 years, relapse rates were significantly decreased. And so we don't have that same data on what happens with 4 years or what happens on 3 years. Now, so if somebody has a substance use disorder mild diagnosis, we're more likely to do a 2-year agreement. And from time to time, and I don't have any veterinarians right now in this position, but if someone is right on that cusp and a program is concerned about what happens if there's not abstinence-based, they may make a recommendation for a 1-year agreement so that we can make sure that sobriety is sustained, because if somebody can go a year without using their drug of choice, we got a reasonable chance that there's not an issue at this point. If somebody, when we're doing toxicology within that year, pops a positive, then usually those recommendations will say, hey, we need to take a look and do some kind of intervention. So at this point, though, the veterinarians I've worked with have been with 5-year agreements.
Anybody else have any questions for Ms. Kelly?
Just a comment.
Ms.
I remember when we didn't have it. And it's a great service. It's a great service to the sport and the profession, because when we didn't have it, there was nowhere to go and no real direction for this board on how to best advise some of these difficult situations. So I really appreciate your work. It's very
Thank
helpful to us all.
Thank you. I appreciate you all being willing to pursue therapeutic alternatives opposed to discipline, because when folks know there's a place to go, it creates hope. And if we've got hope, we got a chance.
I've seen her work as well on other boards, and it's phenomenal. And I just want to piggyback off what she said. Individuals need treatment, not punishment, and not fear that they're going to be punished and lose their license or something that they're struggling with. There may be some repercussions, and they will have to deal with those, but they also need treatment, and this gives them that.
Well, thank you, Ann, for coming and
Thank
talking
you.
with us this morning.
I appreciate you all.
Thank you so much.
Thanks. Bye-bye.
Okay, our next item on the agenda are personal appearances. And we have Dr. Erica Bates. Hi, Erica.
Hi.
Roy, do you have something you'd like to start with? A statement of some sort? or-
Sure, I can kind of fill you in. I can't remember the last time that we were here, but it's been a while. Dr. Bates is still at her,
It's Humane Fort Wayne.
Humane Fort Wayne, sorry. It has been there for many years. It has been difficult getting into surgery of late due to reasons having nothing to do with Dr. Bates, having to do with new employees and onboarding and things like that. Dr. Bates has really tried and been pretty diligent trying to reach out to other opportunities where she could volunteer. And you've all received some of those letters in the past about that. And some of those people have just had their own issues with being busy. And so she's not been able to get into surgery lately, which has been frustrating for her. I've just encouraged her to keep trying. But we hit a little bit of a positive note. She underwent her evaluation with her supervisor, and there was a discussion that the supervisor, Tanya, she's the one who writes the letters that you see, was going to really make an effort to try to get Dr. Bates into surgery rotation again. And so hopefully her 3.5 years runs next month, and hopefully we'll be here at the next board meeting with a motion to withdraw her probation. I think that's probably a good summary, but if you have any questions for Dr. Bates, I'm sure she can elaborate.
I think, Erica, weren't you at the point where you were the lead on the surgeries, but just had another licensed veterinarian present?
In the building, yeah.
You were doing a fair amount of that for a while,
Yes, correct.
but recently it's just been wellness care mostly.
Yeah,
Yeah.
mostly wellness care. And I've been asking Tanya numerous times to get back into surgery, and it's just short-staffed or training new veterinarians. But after having this evaluation and talking with Tanya again, it's possible that I'll get back into surgery. I told her anything you can do to get me into surgery, I need this for my license.
What's the time frame that's, since you've done some surgery, has it been?
It's been a year.
Okay.
Yeah, it's been a year.
Well, and I do also want to add though, Dr. Bates underwent shoulder surgery a year ago. And that prevented her also from working at all. So that is in that period as well.
Yeah, so it would, well, I was trying to count up the months because I knew we were close to, the probation order was indefinite, but with the caveat that she could apply in 3.5 years to come off.
Right.
And that'll be up next month,
Right.
not this month.
Yes.
So between now and April, if you can get on the surgery rotation, you'd have at least hopefully our meeting's the end of April, almost 3 months of back in surgery under your belt, so.
Right.
Which I'm assuming we would want to see that before we modify any probation orders.
Yeah, just looking forward, that would be my feeling, that doing the surgeries and making sure you were comfortable and supervisors were comfortable was one of the big things we were after, so. Sounds like you're trying, so keep letting them know.
Trying.
With it being a year since your last surgery, do you feel comfortable going back in the lead surgeon role? Or would it be more appropriate to have a different situation to begin with?
Well, I talked to Tanya and told her that since it's been a year from when I did my last surgeries, that to start out with doing like cats and neuters and spays, and then gradually going back up to dog spay and dog neuter. I said I'd need to feel more comfortable in that situation before I would even advance to the dogs. And I feel pretty comfortable with doing cats and surgery, so.
So you would leave the base?
Yes.
I have the 3.5 years falling on March 10th, 2024.
Oh, I probably calculated it from the date, I think it was August 28th, 2020.
Yeah, that's what my calculation was.
Are you counting by, I must be counting by months, you're counting like probably maybe by days, maybe that's how I did it. February 28th is how I got 3.5
Okay.
years.
All right, that's fine.
Either way, by the time we're here, next, it'll
At the
be.
next board
yes,
meeting,
yes.
yeah, it'll be April.
So Erica, right now, Humane Fort Wayne is just doing spays and neuters. Are they doing other surgeries as well?
They have been doing other surgeries from the shelter side of the aspect. They're doing like eye enucleations, mass removals, stuff like that. But they're not letting public. They're not doing public.
That's for adoptees.
Correct.
Preparing them for adoption.
Correct.
Shelter-owned
Right.
animals. Yeah, I wasn't sure. I'm kind of out of the loop since I retired a year and a half ago, so.
Yeah.
Humane Fort Wayne, where she works, is expanding. It was the original SPCA, and they merged with a spay neuter group called Hope, and now it's Humane Fort Wayne. They're building quite a facility, a huge facility.
Yeah. They're supposed to be in the building by July. Hopefully.
Does anybody else have any questions for Erica? John? Natalie? Well, if you don't have anything else to add, Rory, I think we're all set with Erica until our next meeting in April. Well, that's up to you, you know. Our probation, is it twice a year you have to
Yes,
appear?
twice a year.
So I guess that's your choice, whether you want to come back in April or if you'll need more time in surgery.
If we don't file the motion for whatever reason, her next personal appearance would be what, like July? Is that how it would work? Okay.
Yeah, I was gonna say we're April, then July, then October.
That's it.
All right, well,
Well,
you'll see
thanks,
us at some
Erica.
point.
Appreciate it, coming down. Be careful driving back.
Thank you.
Okay, our next items on the agenda are renewals and reinstatements. And our first up is Alicia, is it Eisenstein?
Yeah.
Come on up, Alicia. So, Alicia, there's some licensing issues with Wisconsin and Georgia.
Yeah.
Which resulted in you checking the box that you had some prior licensing issues.
Yeah, I think the question, and I don't know exactly what it was framed, have you had a board complaint since the last renewal period? And I did in Wisconsin in 2020. That has since been resolved. We talked about that. With Georgia, it was, again, I don't have the correct or the exact phrasing when I applied for a license there. But I think I interpreted it as your license ever been revoked or suspended. So I clicked no or mark no. But I had done 6 hours of CE, and so it was disciplined but not revoked or suspended. So that was the Georgia. There was no incident in Georgia with a pet. It was just a miscommunication or misinterpretation on my part on the initial application for Georgia.
So in the notes I had in your original Wisconsin licensing discipline, 6 hours of CE, and it was 2 in anesthesia, 2 in surgery, and 2 in medical records. Am I right on that? Can you tell us a little bit about, just briefly about that incident in Wisconsin?
The case?
Yeah, just.
So it was, I want to say it was like February 2020. I was the spay neuter surgeon at a shelter up in Kenosha, Wisconsin. We had I want to say, and I don't remember the exact age, but it was an older, overweight dog that was initially in anesthesia. When it was prepped, the dog was fine. When I started, made my first incision, the dog, was still stable, and then slowly the dog's heart rate went down, and so did its respiration. We ended up, and I used a cocktail of dextromethorphan, ketamine, and butorphanol. We had reversed the dog, and again, I just had 2 technical assistants. They weren't CVT, so it was me trying to do the surgery and do the anesthesia. So I was directing them on what to do. We got the dog spayed, got the dog off the table. The dog was stable with its heart rate, respiration, its pulse ox. In the discharge, and we always have it, is telling the owners to leash walk only, strict cage rest, and especially being an older dog, and her incision was a little bit bigger, make sure that they keep her completely calm. In the notes that we got 24 hours later from the ER was that the owner had the dog running around outside in their backyard and came in and the incision was dehisced. It wasn't fully dehisced, it was just open a little bit. And there was some discharge. They went to the ER, and at the ER, when they went to sedate the dog, they had to give, I don't remember if it was somewhere between 1 to 3 lidocaine boluses because the dog was having arrhythmias. But they went in and they resutured the incision, everything was fine. The owner's complaint was that the dog bled out, which the dog's PCV, and again, I don't have records in front of me, but I believe it never went below 40%. So it went to the board, where they talked to the shelter first. The shelter then didn't want to pay into the ER bill, so then they said they would go to make a board complaint. The dog was stable. The dog never bled out. The dog never had any blood transfusions.
So the dog recovered.
The dog recovered fine, when I sent it home. Sorry, this is. So yeah. The dog was stable when I sent it home. The dog was stable as at the ER except for the arrhythmia. And I think in my notes, sending home with the client was please follow up, because to me, there was something underlying why this dog wasn't stable. I've been doing surgery for 24 years. And to me, if the dog, I mean, you'll have sometimes a low heart rate or low respiration, but there's something off with this dog that I said, please follow up, because I was concerned. So when I saw this dog had, you know, multiple injections of lidocaine for, you know, an arrhythmia, to me, it was like a lot of owner compliance. And again, I can't force someone to go to a GP or to a cardiologist or to a referral place, but it was. So I think the biggest thing, and again, going from general practice, I've worked ER, I've worked shelter, you know, records in the shelter are not what they are at ER or GP. Last, I guess, beginning of the month, I became the chief medical officer at PAWS Chicago, and that's one thing that we're working on. We actually had a meeting yesterday about our anesthesia and our surgery forms, you know, making sure that they are complete, and not just for us, but if the patient is going somewhere, that we know what was given, when it was given, what was the surgery done, what suture was used. So I think from what happened in Wisconsin, you know, it's really kind of impacted me, you know, make sure that, you know, those records are complete. And then also discharge records. Our discharge forms have changed in the 2.5 years I've been at PAWS, because you can tell someone, your dog just had surgery, keep it on a leash, keep it crated. But if people don't see it in writing, and now we actually have them sign the discharge also, so that, you know, we could just tell you, you read it, you know, if people read it and just signed it, but at least that way, you know, like I said, it's impacted me to be like, hey, things have changed a lot in 24 years of practicing, you know, when clients wanna, and I won't say they wanna blame someone, but sometimes the personal responsibility doesn't lay on them, but I will take, you know, I learned a lot, you know, from that case.
We've had that situation arise in our board before, high volume, low cost, spay neuter clinics and rapid turnover. And we feel like we still have to hold those clinics to the same standards as private practices.
100%.
But there's always been a lot of debate on how you handle feral cats and how you handle shelter animals versus client-owned animals. But in the past, our conclusion, I believe, and I don't know if any of the board members disagree with me on this, but we had concluded that we had to hold those clinics to the same standards as the general practices.
And I would think that they should be. I mean, I feel like so many times we hear low cost, but for me, it's still, it's high quality, high volume, you know. I don't just want to do high volume. The quality is not there. And last spring, either March, April, I actually stepped down from PAWS. I was there as their medical director of spay neuter, and I was there 4 days a week, and I went to 1 day a month until they got, I said, we were sacrificing safety for numbers. I said, until you guys can prove to me that you'll change something, I'm not a factory. Like, I've done the days of 80 surgeries, you know, in a day and stuff like that. And at some point, your quality is going to decrease with that. If you don't have, you know, the right support staff, you don't have the right monitoring. So we've hired 3 additional certified, and this is again in Chicago, I've since left Wisconsin, 3 additional certified technicians. We got 8 new pulse oxes. They're getting, I think it was 4 or 5 new kind of full monitors and stuff like that. Because for me, I don't care if it's a shelter pet, if it's a own pet, if it's a feral cat, it's still a life on the table in front of me. So I don't care, you know, who I'm working on, you know, I want to treat them all the same. And I feel that wherever I work, they need to see that, you know, as the same. So I feel that, especially the word, you know, when we say high volume, and we've done interviews, you know, with the news, it's, I don't want to focus on the high volume, it's the high quality and, you know, high volume.
So your address is Illinois,
Yeah, I live in Illinois.
but you're going to be doing some practicing in Indiana, or is it just because of?
So Indiana, I have a license here because during COVID, I was working full-time at an emergency clinic that I still fill in at, but it was the shelter kind of, with COVID, everything kind of slowed down a little bit, and I went into the ER world. So that's why I maintain a license here. The only spay neuter I would do is if it was a pyometra that came into the emergency room, and I don't know why an emergency neuter, I've never done one, but,
So you're gonna still be doing both?
yeah, so I fill in, it's EVCC is the emergency clinic that's in Highland, Westville, and Mishawaka, and then they just opened up in Holland, Michigan. So they have quarterly doctors meetings where all the doctors go to the meetings. So they need someone to come in and fill in that gap so that they're not closing to 24 hours. So I usually do a 4 to 9 shift, like 4 times a year, or if they need an overlap doctor, I'll come in. So that's why I maintain my Indiana license. And I guess why I originally got it was I had owned a practice in Evanston, Illinois. And when I sold, I was in an ironclad non-compete. And so it kind of took me out of the Chicagoland area. So I started practicing at general practices. I think St. John was the main one that I was at.
Do you have any questions from other members of the board?
So the real problem was in this was in the shelter, was this a shelter animal or
It was
was?
an own, we did public and
Okay,
shelter animals.
what kind of pre-surgical exam did these animals get?
I do the pre-surgical exams, so it was, nose to tail, making sure gums are nice and pink, heart rate, respiration rate, temperature, no obvious abdominal mass, and then if it's a male dog, is it a crypt orchid or not?
This dog in question, was it on any kind of heart monitor when?
We just had pulse oxes, so I think after that, I got them on Amazon, but I didn't get the exact thing, but it was a pulse ox, EKG, it could do non-invasive blood pressure and temperature, so I bought 2 little monitors because the shelter didn't want to get them, and again, it's one of the reasons why I left there, because.
So if that dog had had a pre-existing arrhythmia, you wouldn't have really been able to tell that.
No. So, I mean, that's why, like I said, moving forward, anywhere that I am, I have to be comfortable, not just with the surgery, but that I have competent people, around me, that it's not very hard to focus on the animal doing surgery, let alone worry about the anesthesia. And I feel like that's anywhere that I worked up until now. It's always been me and 2 tech assistants, not certified tech. So navigating all of that, it's been interesting to get me where I am. But I think because of that, going into this chief medical officer role at PAWS, I'm very big on, we're redoing our training with not only our technicians, but also our doctors, so that the techs don't just rely on the doctors don't just rely on the techs, and people understanding anesthetics. I feel like especially in the spay-neuter world, the high-volume world, it's very easy to just focus on spay. We say it's routine, it's not routine, it's still a surgery that can have complications, and I think people have to be aware of the anesthesia and understand that. So we've actually revamped a whole training system at PAWS and brought in a anesthesiologist to help with that.
Anybody else have any further questions for Dr. Eisenstein? Rory, do you have something you want to add to?
I don't think so. Unless you have something you want me to answer.
We entertain a motion about reinstating Dr. Eisenstein.
Yeah, I'll make that motion. I have no issues with what I've heard and where we've gone from that. So I'd make a motion that we reinstate, barring any paperwork testing needs to be done.
Renew.
Oh, it's, yeah, renewal.
Oh, sorry.
Sorry.
No, you're.
Renewal,
Correct,
yes,
correct.
yes.
Again, this is-
You're under a broad category, renewals and reinstatement.
Sorry.
I'm sorry.
No.
So I would second the motion to renew Dr. Eisenstein's license without restrictions. All those in favor?
Aye.
Aye. Anybody opposed? Well, thank you.
No, thank you so much.
Good luck.
Thank you.
Laura, when does that appear on the website?
Today.
Today. Thank you. After the meeting. Awesome.
Thank you so much.
Next up on the agenda is Aaron Davidson, RVT. Hi, Aaron.
Hi,
Have a seat.
thank you.
So Aaron is before us. I believe you had in your notes from Laura, OWI incident in May of 2023. Is that correct? And was on a probation
I'm on probation now.
is it for a full year?
Yeah.
Yes.
I do have 2 letters. I have a letter of recommendation from my medical director and a letter from my probation officer, if you guys want to see that.
Yeah, we can, if you want to hand them to Clarence and you can pass them around real quick. So, Aaron, can you just give us a brief statement of the OWI incident?
Yeah, so I was at my best friend's wedding reception. It was an open bar. And I just had a couple too many chocolate martinis and drove home and was pulled over by the police, obviously. And they did the field sobriety test and I blew into the meter and I was intoxicated.
What was your BAC blood alcohol? Do you know?
0.186.
So you were definitely over
Yeah.
0.15.
Yeah.
Any accident involved in this?
No.
Why did you get pulled over?
I switched lanes without a turn signal.
And was your license suspended, driver's license?
It was for 6 months and that was recently reinstated.
And then I thought I read that pretty standard in these cases, you had to pay a fee and undergo a drug and alcohol assessment program.
Correct. And I did that, and in the my probation officer's letter, it says that I've been compliant with all my court fees, probation, and doing that drug and alcohol class.
And the class, when did that end?
It was a weekend class, and that was, I think it was in November, December.
Any prior OWIs before
No.
you became an RVT?
Nope.
Anybody else got any questions while I read through this?
How do you handle if you're out and about nowadays?
I haven't
changes?
drank since I got pulled over on April 29th. And that's part of the probation is not going to anywhere, anybody under 21 can't go, so no liquor stores, bars, sitting at the bar and restaurant. And I haven't drank since then.
What is your out, if you will? What do you have stress relief and whatnot? Have you found things that you do to?
I have 2 young dogs and they like to play ball, so I'll go to the dog park and throw the ball around with them, get their energy out. But I work quite a bit, so I love working, so I pick up shifts in my free time.
Do you feel you have a support system
I do.
and they are a good influence?
Yeah.
They're not ours.
Who's your probation over?
May 18th of 2024, yeah, sorry.
As part of this probation, do you have to undergo any kind of random testing or anything?
Yes, I do. I have yet to be called for any random testing, but that is a stipulation in my probation.
Okay. And that'll continue until
May
May
18th,
of
2024, yeah.
We can't do anything until after the report, right?
We can if we want.
What we're talking about is if your probation's not over until May, we have to wait till the end of that.
No, because it's already been convicted.
Yeah, you don't have to
wait.
Board members, in your folder, there is a 1-sheet piece of paper that goes through this process. Clarence, I know we have it too. Okay, no. It's the renewal statute. I'm sorry if you don't have it. I'll make sure you have it next time.
Highlights.
So what it talks about is your options that are available to you. So she renewed on time. So the board has 120 days to decide on this renewal. So she's an RVT. So they expired on January 1st. So we're not under the deadline to act on vet renewals with her because she has more time. So keep that in mind. Also, it lists the avenues available to you, which include simply renewing. You can renew on probation, but she has to agree. And that probation can run concurrent with her criminal probation, but she still would have to come before the board to have that probation lifted. So the board next meets April. Her probation or criminal probation is over in May. So once criminal probation is over, then she'd come before the board, which would, our next meeting after April would be July, and provide that she successfully completed probation. The other option, I can't think, renewal, probation.
My recommendation today was just want to place her on probation and then she
Yeah.
can petition to come off when her criminal probation is over.
And then
That's how we do it
that
along.
ensures that she completes criminal probation. That's what that statute is for.
So we can renew her license on probation, and she could appeal to come off that probation in October,
Whatever we list.
be October, or July, I'm sorry.
Okay.
I skipped a meeting.
I
She
do,
has to agree to it.
I do have a question.
Yes.
I'm planning to move to Portland in just under 3 weeks, so I just didn't know what that would look like for me.
Portland, Oregon.
Yes, sorry.
Portland, Indiana's not far from me.
Portland, Oregon.
Portland, Oregon.
We have
Portland, Maine.
the electronic meeting policy now, so that shouldn't be a problem.
What would my license being on probation look like?
It would simply show on the public interface that you're on probation.
Okay,
And then if someone wanted to request that record, while you're on probation, that's considered a litigation document, so they could request that through a public records request.
okay,
And then if you want to come before the board to have that lifted, that would be in July, as long as you successfully complete your criminal probation. And then if you're in Portland at the time, we can arrange for an electronic meeting before the board.
okay. But it doesn't hinder anything that I would be able to do, like I could still handle controlled substances for surgery and things like that?
Yeah, when we do a probationary license, we can spell out exactly what that entails.
We probably can't speak to what Oregon,
Okay.
you would
What
ask, because you'll have to
Oregon
be
would
licensed
do.
in Oregon.
Would I
assume.
still be able to transfer my license on probation to Oregon?
That would be,
That'd be up to Oregon, but
Licensing board, okay.
yeah, if you order a verification, I would fill that out and list, provide them the disciplinary documents, and they would review those and maybe ask some questions.
Okay,
I can tell you from this board's perspective, it would depend on the facts and the situation. I mean, it just depends. I can't speak for Oregon.
okay, thank you.
Your thoughts, Natalie?
yeah, I guess I was looking at this. The top one, and is the option to basically take no action for 120 days and then review the renewal? That's what I wasn't sure how that.
We could do that, but we would have to act in April. And we
So it's
pretty much be in the
120
same
days from
situation.
February 15th, that's.
120 days from January 1st,
Oh,
when their renewal was up.
Because it,
I could ask for veterinarians based on the October.
oh, okay,
February
February
date
15th
is-
is for veterinarians.
Yeah,
Sorry, that's what I got confused about.
So
Oh, that's-
in April, we'd be in the same situation.
Right, yeah, that's what I was confused, sorry. I was
Sorry.
looking at this. And you said that, but I was reading. Oh, well.
The chances are, Aaron, I can't speak for Oregon,
Sure.
but this could pop up if they were to do any kind of state police background check on you when you apply for an RVT license in
Okay.
Oregon.
Yeah.
So it's probably gonna pop up anyway.
Okay,
I say probably, but I don't know Oregon's process, so
okay,
I couldn't promise you it will or won't, but in this circumstance, if she was applying from another state here to us in Indiana, we would
have to disclose.
you would have to check
Yeah.
that box that you were arrested for an OWI, and then we would make you come and ask you
Right.
questions. anyway.
okay, okay.
I suspect you're gonna have to do that in Oregon, no matter what we do.
Okay.
In the meantime, if we renew your license on probation, I'll leave it up to the board if there's anything specifically they want to put in there. But from my perspective, I don't think I would necessarily limit your being able to use controlled substances in surgery and things.
Okay,
Yeah, I think typically we've just done renewing under probation pending the successful completion of her criminal probation, and then can withdraw to come off
Right.
as long as those terms are
And there's,
completed.
you don't see the need for any other restrictions, I guess.
I don't think so, based on, I mean, the letters that she got, it doesn't seem to affect her practice at all. She's kept her job for many months now after that without incident, so.
So you make the motion.
Want to make that motion then?
Yeah, I make a motion to renew, sorry, what's my word?
Care.
Under probation upon, with the option to withdraw upon successful completion of her criminal probation.
A second.
I second that.
You got 2 seconds.
I know,
Take a pick.
I'm gonna take our newest board member.
She doesn't have one, right?
Oh.
So all those in favor of renewing Aaron Davidson's RVT certification on probation until her criminal probation is expired and can come before us in the July meeting to petition to come off. And you can do that virtually.
okay. Will I just get another email like I did for this meeting? Telling me like when it would be?
No, it'll be a little bit different.
Okay.
So for probation, you'll actually get a hearing notice.
Okay,
But it will be sent via mail
okay,
to your current address. So you're gonna wanna make sure if you do move to Portland, you send me an email,
okay.
which I was the one that emailed you about this,
Mhm.
that you send me an email with updating your current email address, phone number, address, specifically your address, so I can get that out to you.
Okay.
Okay?
All right.
So all those in favor of renewing the RVT certification on probation, say aye.
Aye.
All those opposed? Okay, Aaron,
Thank
Will,
you.
will that explain the process to her? So once you've successfully completed that, you'll get the hearing notice, and then you'll have to petition, so you'll have to ask to remove
Okay,
the,
Yeah,
And that
that'll be in
will-
order.
okay, cool. So there'll be instructions on how you can then
thank you.
do that.
all right, Aaron,
Thank
good
you.
luck.
Thanks.
Don't go to any wedding reception.
I know, I think I'm done with wedding receptions for a while.
Thank you. Okay, whatever, reception in Hamilton County, that.
Is everybody okay with continuing on? No, nobody needs to run to
Does anyone need copies of those?
I will put those in a record.
you guys good with continuing?
Yeah, I can go for a little longer.
All right, next is Dr. Joseph, is it Brand Stutter?
Yeah.
And we're looking at, check my notes here, had some discipline with the Ohio board involving a CAT dental procedure. So would you like to, I think I got the gist of it, reading between the lines, but would you like to give us a little information?
This was back in May of 2020. I did a dental procedure on this cat, and it wasn't until November of 21 that there arose a concern. It was a stomatitis case. It's gross inflammation of the gingiva. And so I extracted the teeth, but it was by crown amputation and root atomization. Didn't think with the anesthetic time, my skill, I could get those teeth out the standard way. And so I had done this procedure in the past with success. I thought it would be okay. And another veterinarian had seen it for a bladder infection in November of 21, so like a year and a half later. And they had seen that the gingiva were inflamed again on the site of the extractions. And so the veterinarian said, oh, he just broke off the cat's teeth. And so she was inflamed, calling back, cursing. And then that's how the complaint ensued.
So the Ohio board was not happy with crown amputation and root atomization? Okay. So $250 fine and then 4 hours of CD. Is there anything about that 4 hours of CD that would change how you handle things?
Well, it's the instructions are to drill a moat around each root, get all the roots out, sew it flat. And so when I see cases like this, which aren't many, I just refer them out because it takes like 5 hours. It's like I can't do it, and so that's what I do.
Did you have dental X-rays available at the time? How about now?
I still do.
So you're referring these? Well, do you have any discussion, Steve? You and I have both been there.
Exactly, yeah.
Well, I'm sure John has too.
It's a changing world, and those situations were not referred often back in the day because people were not willing or able, and more so they are. And so I think that's the recommendation that I would give, but I've also been in your same situation as well. And I guess I would, like most of these cases, communication, and making sure that the owners understand if you're going to do something like that it's not necessarily the gold standard, but I personally would not call that negligence if the communication was there as to the difference.
It really affected me psychologically in every way because I had these. I brought back a couple of my former clients who I had done it on, took pictures. 2 years later, mouth was still good, the cats were doing well. The cat hadn't lost any weight. And it really, she's writing me emails, barraging me saying I'm evil. And she's going to make sure everyone knew I was a fraud. And it's just, I wasn't trying to do anything bad. I really wasn't. So,
Well, it makes you feel any better. It's been my experience, some of those chronic stomatitis cats are going to be that way no matter what you do. Even though the new standard of care is full mouth dental x-rays, extractions, follow-up x-rays that you got all the roots out, and flaps, which made me glad I retired when I did. So, I'm sorry, I shouldn't make light of your situation. I apologize for that. I guess I, given the circumstances, would make a motion to renew Dr. Brandstutter's license without any restrictions.
I would second that.
Any further discussion, John? Anything you want to add? Dr. Peelman? All those in favor of renewing Dr. Brandstutter's license, say aye.
Aye.
All those opposed? Thanks, Doctor.
Good luck.
Next up is Dr. Mayer, Meyer, I'm sorry.
I was like, unless my ears are very bad.
Morning, Robert.
Morning.
Dr. Meyer appeared before us at our last meeting. There was a OWI, I believe, in May of '23.
Correct.
And his case was still, criminal case was still pending, so we postponed any action until this meeting. From my reading, it looks like you were given about a year's probation and also a license suspension of 60 days, correct? And then alcohol program fee, they always say you had to pay the care fee or whatever. So I guess if you could just refresh us briefly on the OWI and where you're at now.
As far as the arrest goes, or?
Yeah, I mean, I kind of remember the details. It wasn't that long
Yeah,
ago.
I was driving home from work.
Dr. Peelman's new to the board, so,
Okay.
and I don't believe Natalie was here last time, so.
I was driving home from work. I had my dogs with me, and I didn't feel it was safe for me to drive. So I pulled over to an exit ramp and parked the truck and basically took a nap. And that's when the officer came up on me and tapped on my window and took me out of the truck and arrested me at that point. So I went to jail for 2 days, and then was released. And from there, I went to detox in Bloomington. That was 4 days. And once I got out of detox, I went to IOP at Landmark in Fishers, and that lasted 3 months. And I was tested throughout that time in Landmark. And I graduated from that in August.
And then there was some mention, did they drop the charge of resisting arrest or?
Yeah, they pretty much had to.
Wasn't there an issue where you were actually injured
Oh,
by
yeah.
the officer, if I remember right?
Yeah, he pushed my face into the pavement. I wound up with 2 black eyes and a bunch of scars.
But that charge of resisting was dropped.
Yes.
What was your blood alcohol again? I don't recall.
0.3.
Any prior OWIs?
No.
Where were you consuming the alcohol before this happened? Were you at a?
It was basically in the parking lot of the liquor store.
So you left work, went to the liquor store, and then from there drove and then took a nap, and then the officer found you.
Have any questions, discussion?
This criminal probation ending on November 10th. On those.
Of
2024.
We're in a similar situation on the criminal probation.
Is work the root of your stressors?
Is what?
Was work the root of your stressors?
Not really. It's more of a, recently got divorced, and that certainly hasn't helped. And, of all the things that I do, work actually is a stress relief.
Therapeutic. Mm-hmm. Do you feel like you have a support system now?
I'm seeing a therapist twice a month. I'm on medication for, they diagnosed me with moderate to severe depression, moderate anxiety, and PTSD. So I'm on Zoloft and naltrexone for those things, and Keppra.
And you continue to go to a therapist, so you still have some support?
So is drug monitoring and alcohol monitoring as part of your probation with the criminal court?
No,
There's no random testing or
No.
anything?
On the probation order, it states you may have to take an alcohol class. Is that something they're going to require?
when I talked to my probation officer, he basically said, if anything comes up, I will call you.
Okay.
Thoughts, Natalie?
Had it was alcohol, had it affected your practice at all prior to this? It was
No.
something you kept totally separate from work and just,
How many practitioners are with you? Your
It's-
practice?
I'm an associate, and we have an owner. And the owner only works 1 day a week, and I do the rest.
And you still feel like ultimately that is therapeutic, even though you're a single practitioner, basically?
I think it is, and the owner of the practice is an older gentleman. So I'm kind of doing his work and my work. And it's nice. It's almost like I'm a part owner, but not really. But I have the final say in pretty much everything.
So you have a lot of responsibility,
Mhm.
but that feels positive.
And I just wanted to make sure that you guys still had the letter from the employer that we brought at the last meeting. Is that something that you still have?
I don't
You don't.
Not in
remember
our current
seeing
things.
that
You don't remember seeing it?
in our current
Not in the
notes.
current notes.
No, I remember you bringing that,
yeah.
and, let me see if it is in the, you did email it back to me, because I didn't have it. So if you need to
Yes.
check your emails,
Yes.
maybe that might be a way that you could find it too.
And what's your name?
Brandy Haggerty.
While she's looking, I guess I would just say my concerns. I mean, a DUI, OWI, that's I don't want to say there's different levels of them because it's an arrest. But my concerns with the situation, I guess, as far as point 3, is one of the highest numbers I've heard in here. Going to the liquor store, drinking there, leaving there. That worries me with the stresses that you were under that led to that, and how that's going to affect things moving forward. So that's where my mind is as far as trying to decide what we do here.
I was thinking, typically, I mean, obviously, the precedent we always have is at minimum probation until the criminal case is cleared up. But I do think the way we word that potentially would be that would be the earliest. And then I think we would have a chance at that time to ask what kind of maintenance is still in place. Are we still, psychologist meetings are still happening, if medication is still being used. We don't have to grant it at that time if for some reason there's, because that's kind of, I think, I share some of your concerns about it being so near to work.
And then also,
Obviously, it wasn't at work, so that's not.
not being part of the probation currently with a criminal case of testing and whatnot. I guess I just would feel more comfortable if there was something in that regard.
This is really what I'm thinking too, this would be a good example of presentation we heard, because he's not getting any follow-up at all from,
I think he said he's doing it.
You can't open the file.
Yeah,
I'll go
but-
check my office.
I don't know, I've got,
I mean, sometimes we've asked for a report.
You also require personal evaluations would be one option.
Say that again?
You gonna require personal appearances or quarterly reporting from his employer for a couple options too.
Remind us, an evaluation was or was not done as part of this so far?
It was done at the hospital when I was admitted. It was done at the detox center, ICRF, and it was done again at Landmark. It was done again when I started seeing my therapist in Shelby.
When you want?
When I would see my therapist in Shelby.
Oh, okay.
And through those evaluations, no one ever said, we need to do routine testing or there's an issue here?
Well, I did the testing when I was in Iowa.
When you-
And occasionally the therapist will do a random test. But there's nothing written down about that.
And the IOP was a 10-week, 32 sessions program, outpatient, it's an intensive outpatient program.
And that was court ordered?
No.
That was voluntary?
Mhm.
Okay.
And was completed, sorry, I lost the time. Was completed
August.
in August, okay. How are you feeling now?
With medications, I'm feeling better.
Dr. Meyer, was there any particular trigger besides the divorce that resulted in you going to the liquor store that day and consuming that?
That day, no.
alcohol? No particular stressful event that particular day?
Was that a, I don't say a routine thing, but was that something that you did off and on? Was that just out of the blue? Okay. And now, where do you stand with alcohol and what you do and whatnot? Where do you stand as far as alcohol and
I don't do it anymore.
don't do it? And stress release now, have you found anything, work you mentioned, but anything else that,
Work. Getting back into my hobbies. This time of year, I like to think outside. It's so crummy outside. You can't do a lot. I fly fish. I have a bunch of guitars. I have 2 dogs and a cat. And, keep myself busy doing that stuff.
Are you in anything outside of work that involves a group of people?
AA once a week.
So do we have anything in writing about an evaluation?
There was a
A
letter from
document?
Landmark that said that he completed that program, but there wasn't, it's not a report.
Because you see the road I'm going down.
Yeah.
Normally,
I'm
we
sure
would
that's something that we
refer-
could get, and he would be more comfortable continuing with the people he already has relationships with. So if you would like a report, I'm sure that we could get that from Shelbyville Behavioral Clinic.
Because normally we would refer to
Right.
Ms.
The
Kelly's
wellness,
program.
yes.
But if you're already in a program and an evaluation has already been done, but I think to Dr. Sunbury and Natalie's point, the concern is monitoring, which we know the veterinary well-being automatically does that.
Yeah, I think before we requested quarterly updates or how monthly or whatever is relevant here. So I think I'm leaning down that line, whether it's from employer or if he's comfortable in continuing to still see psychiatrist or whatever report. I know we've had multiple different kinds of reports that have come in, so I guess I need to look back and see specifically what all you think is relevant here, but I think with
He stated he'd seen a therapist, so you could request reports from her
okay,
for him.
I think I'd feel more comfortable along those lines just to have a little bit of
And you're going to
Inside.
AA, do they understand once a week? Okay.
So would you be in favor, are you gonna make a motion to renew on probation with pending?
I believe so, because as far as I can tell, I don't think the practice has been affected. So I think we'd all probably feel more comfortable knowing that that was going to continue to be the case over the next several months, as this kind of gets worked through. But I'm open to what you all think.
So you ready to start typing?
Yes.
Are you ready?
Are you ready to craft a motion or?
Well, I guess I think we should probably have a little bit of discussion of what that reporting looks like. Are you guys comfortable with quarterly reporting? Would you like to see it more often?
Well, I think first off, we're going to want to see a report from
The evaluation?
who
Okay.
evaluated. What the evaluation.
So just a
who did
review
it,
of the
when was
completed
it done,
evaluation.
right.
Quarterly reporting from employer and health professional.
Therapists.
And that's just kind of a status update of everything continues to be on track, hopefully. And then, is there anything else we usually do? I would say obviously that would line up, the earliest to petition to come off would be once there's been a successful completion of criminal probation. But I think again, we'll be able to evaluate that at the time and see if that feels right, or if we feel like there might need to be more monitoring in place after that, keeping some of that in place. So an
Indefinite probation.
with the option to,
With the option to.
because that gets us
appeal
through the end of this year. Because when was the original incident? It was
May 4th.
May 4th of 23. So we're not even a year in yet.
But
Yeah.
his criminal probation is up in November.
Correct.
Yeah, November
Yeah.
10th.
They kept pushing the trial back.
So he would, it would be, he could petition to come off indefinite probation after the completion of the criminal probation,
At the earliest.
which would be, he would have to do that at our January meeting next year.
Mm-hmm.
Do we want to see him sometime before January?
That's the court.
Yeah, I guess the
We're
person,
gonna
if,
have to-
Oh,
So it reports and him.
Yeah,
Okay.
so there'll be, he'll have to appear,
Do you
we
want that
usually do twice a year.
quarterly or, yeah, that feels like a lot.
Quarterly reporting with appearances twice. With appearing twice on
A
the.
lot of those we've done every 6 month appearances if we get the quarterly reports is out.
Twice a year.
Okay, so we just need
Every
to see it in
6 months.
July.
And
Yep,
then
we have
hopefully in
that.
January, everything's
where we
going
are.
really well. Does that seem right? Motion that.
You want to read that back?
I can read it off.
Okay.
A motion to renew on probation, then he can petition to come off after his criminal probation is over. Quarterly reports from his therapist and the initial evaluation from his therapist be submitted to the board. Employer quarterly reports and a personal appearance every 6 months.
A second.
Is that
Is it,
the motion you're
Yes.
comfortable making?
I believe, does anyone have any edits? I thought that was reasonable.
And Dr. Peelman, you're seconding that?
Yes.
I'm gonna let Laura catch up here. She's typing feverishly.
I'm fine.
Okay. All those in favor of the motion to renew the license on probation with the terms outlined? All those in favor, say aye.
Aye.
All those opposed?
I just wanted to clarify, are those terms starting today or when we get the final order?
When you get the final order.
Okay, great, thank you.
Which he's really fast at getting those out.
Great.
So then I work really fast to get them to you guys.
Well, that's good to hear.
We have the link,
I did just send you it again in an email with it, hopefully,
but
but it's not through your, it's from my computer, so hopefully it's from my file.
But it was a positive report from the employer.
Yes, yeah.
hasn't come through yet.
But we'll take your word for that.
Okay.
It was, because I sent it back to her. Oh, there it goes.
Oh, great.
Yeah, employer letter. Yep. Okay, so I will drop this in SharePoint right now before we close out the hearing. All right, I just dropped his employer's letter in SharePoint. It's right at the top. And thank you for.
Yeah, we got it.
I should have brought it in person.
My computer just kept saying the link is broken.
It did for me too when maybe it times out after a certain.
Yeah,
amount of time.
I lost my, good thing I took written notes. I lost my connection to the vet board too. Oh, well.
There you go.
Did you guys get it?
Yep.
Yeah. Okay, this is dated November 23.
Yeah, that.
Want to scroll?
Yeah. All right, I think we're in good shape then for renewal on probation. Thank you, Dr. Meyer.
Thank you.
Coming today.
Thank you very much.
You guys need a break before we,
I could use like 5 minutes.
okay.
Just because I come here and I drink coffee.
So let's recess and come back at 10:35. How's that sound?
Okay, that's a lot of minutes.
Okay, our next case is Dr. Robert Medlock under renewals. Hi, Dr. Medlock, thanks for coming. This case with Dr. Medlock, once again, Natalie and Kelly, he appeared before us at the last meeting, but he was still on a criminal probation thing, so things were continued on. So this is also an OWI case, July of 2023, am I correct?
I believe so, yes.
And if I read my legal paperwork correctly, did you have a license suspension of 90 days?
Yes.
Driver's licenses, and similar probation for a year? And that's till November?
Yes, I believe it's the 26th, 27th, something like that.
Yeah, November 24th to
Yeah.
24 or something like that. Okay. And if I'm correct, you did have an evaluation was as part of your criminal probation?
Yes.
Okay. I thought I had read that. You
Yeah.
paid $360 for an evaluation or
Yeah.
something like that.
Yeah.
I'm getting good at reading these legal documents.
This is in Monroe County again too, right?
Yes. Could we possibly get a kind of a,
Yeah,
I'm
what I
sorry,
was
but-
gonna do, because of our same situation with Dr. Meyer, because of our two board members that weren't at the last meeting, I was just gonna have you go back through again. The only thing that before I stop talking, in your case, I don't remember us discussing this last time. I saw something that said there was a restitution to a victim for $250.
Yeah, in the course of my discretion, I made contact with the two vehicles
Okay.
and there was damages to be paid.
And was this over and above what insurance wouldn't pay? Is that why?
Honest to goodness, I don't know.
Because I thought $250.
pretty minimal for,
Yeah.
Yeah,
You
no,
can't even scratch a car and get that
Yeah.
fixed or.
Yeah, so I'm not certain on that. I don't know.
Okay.
I just.
But no one was injured?
No.
No. physical injuries to any other drivers. All right, well, go ahead and just recap what you told us last.
It was just a culmination of a really, really bad day. Deciding to sell my practice, finding out that those that were charged with paying the bills weren't doing so, and finding out that I owed $165,000 out of pocket. It was just a bad day. And I made a bunch of bad decisions. I'm legitimately embarrassed. You guys don't deserve that.
Well, in your circumstance though, like we went through with Dr. Meyer, where did you consume the alcohol?
I stopped at the VFW on the way home.
Okay.
Yeah. And got overserved and was checking emails for work and trying to drive at the same time. And went left to center. And
so that's why you were pulled over.
Yeah.
And then well, I asked this question because it's not always on these police reports. It's hard to find. What was your blood alcohol?
I don't recall precisely. It's like 0.2, 0.21, somewhere around there.
Because a lot of times these reports say greater than 0.15, but then you don't know if it's 0.16 or if it's, as our previous case, 0.3.
It was not 0.3.
There's a big difference between.
Well, I mean, 0.2 is bad enough. But
so it was around 0.2.
Yeah.
So that's kind of the background. You guys have some questions?
Again, just to get the situation in my mind again, you went left to center, but you did, what, 2 vehicles?
It was,
make contact
it was,
with?
it was contact one vehicle, just left to center, airbag deployment, like I couldn't see. And like it actually broke the front tie rod on the driver's side front, which took me further left to center. And I've got full curtain airbag deployment in front of me, and I just couldn't, I'm hammering on the brakes. And I contacted the second vehicle in the process of that. Yeah. Still horrible to see, but here we are.
So, Dr. Medlock, where are we at in your program as far as rectifying the situation, counseling, drug?
Yep, I've completed the whatever diversion course. I completed that. I'm enrolled in an online course. Like it just fits with my schedule, where I can just do it either over my lunch hour or after work. And then I also am talking to a therapist. This is never like, this was just a really, really awful situation that put me there. My own decisions put me there. Like I take full responsibility for that. That's not where I'm at now. I'm not drinking. Well, I wish I could portray to you in a sense that is not, I don't know, but like this, like to me, veterinary medicine is a big deal. Like it's like you all should be embarrassed. And I'm embarrassed for having made those decisions.
Have you sold your practice?
I did, yeah, had to.
So what is your employment and?
I'm still there. I'm medical director. Yeah. I've built this thing over the last 12 years. I'm not leaving. Like I have too many patients that count on me. And It's family. Yes, it's family.
So is this a corporate sale then?
Yes, a consolidator.
I guess my question is moving forward. Specifically, I think the board would like to know, what, besides the online course, if you're seeing a therapist, how often, and was the same questions you sat here now.
Yeah.
Heard of two other cases. Did you have an evaluation by an alcohol and drug addictionologist type person?
I did not do that.
Okay.
I didn't. This, honest to goodness, was like just a one-of thing. It was just a really bad day.
So that day, was that the day you found out you were 160 grand in the hole?
Yes.
Okay.
Yeah.
That's what I thought.
Yeah.
It was that same day.
Yeah.
They're not working for you now, are they?
No, no, but they're available to hire. I will not write them a letter of recommendation. Yeah. But
And no prior OWIs,
No.
obviously, or we would have seen you before now.
Yeah, no, yeah. It was just an absolute embarrassment.
Now, when is his criminal?
It'll be just like Dr. Myers, it won't be till November.
November?
24.
And he's on probation now, right? Criminal probation.
I don't mean to add to your stress, doctor. How do you feel about what you heard from the veterinary well-being program today and from Ian Kelly? How would you feel about that? The first step, I guess, which is the evaluation.
Yeah.
Not necessarily the contract.
Goodness gracious. This is where my wife usually tells me to shut up.
Okay. I've been there.
We all have.
Pretend your wife is sitting next to you.
Then I'm just not gonna say anything. That's how I feel about it. If you want my honest opinion, I'll tell you.
Well, this is your hearing. So you're
Yeah.
entitled to say anything.
I feel like a lot of these organizations have a lot of people getting paid to do a lot of things that I already know. I will sign up for it. I'll do whatever it is that you all tell me to do. That I will do. I'm not protesting it, but my honest opinion is it's needed for some people, and sometimes it's just an effort or an avenue to make money.
Well, I won't interject too much of my personal views on this, but what she said this morning clarified for me is that a referral to her where she can do an evaluation for you to help clear things up with the board doesn't necessarily lock you into a 5-year contract and a lot of expense.
Yeah, and I'm, like I said, I'm totally fine to do it. But you asked me my.
And if not that program, which I know John feels strongly about because he was instrumental in getting that set up on behalf of the IVMA.
Yeah.
If not that program, though, I think the board in general likes to see some sort of independent alcohol and drug evaluation to give us some peace of mind that what you're saying is correct. It was a one-off deal.
And like, I have no qualms. I have no qualms. Like, I'll sign up for it. That's totally fine.
What I like what Kelly said was that she knows people around the state, and some of them are qualified, like you were alluding to. Some of them they have to have somebody on staff to do this, and they may not be as good of an addictionologist, quote unquote. I don't know her personally, but I know this program works as far as an honest evaluation, and that's what I think we see the board here struggling with.
Sure.
How honest is that? May not be the right
I
word.
know, I
But,
know
you
you're
know,
going, that's fine.
how credible is the word that we're getting, you know?
As a board, at least as the veterinarians and or technicians that are up here, if this was something where we had to help evaluate what you did veterinary wise, we would feel much more comfortable with,
Yeah.
okay, we all have our opinions and we can make what we're, we've all been educated on that. When it comes to addictions and whatnot, we can have a gut feeling or a general feeling based on this brief this talking, but we're not comfortable making a professional decision on, okay, is there a deeper problem here or not? I guess that's the
100%.
mindset, if that makes sense.
100%, 100%. And so, if you guys can email me that link, is there a link to sign up for that evaluation or?
I mean, we'll continue with this, but I think the discussion we're having is more the evaluation, not become part of the program necessarily. It may turn into that, but we're looking at for the evaluation.
I mean, you would have the option, Dr. Medlock, of choosing somebody else to do that
Well, if
evaluation.
this is who you guys recommend, that's who I'll go with.
I think I've been on the board 12 years. This is the start of my 13th year. I never envisioned becoming an expert in addictionology, as Dr. Sunbury said. That was a surprise.
Yeah.
Unfortunately. And so we had to rely on someone, and that's why the IVMA came up with this program. And as Ms. Kelly said, it was timely she was here today. Expense-wise, it sounds to me like their program is quite a bit less expensive than some of the other ones.
Oh, yeah, I've
But
looked into
the
this.
first step would be the evaluation, and she may very well write us a letter saying this guy does not have an alcohol problem that requires further counseling or monitoring, and that may be the end of it.
Yeah.
But I think we would lean towards you practicing on a probationary license pending the evaluation and an appearance at the next meeting, something along those lines.
And that, I'm perfectly happy with that.
All of the above. If you can put that in words, I'll second it.
Yeah, because unfortunately, the standard for the board has been, you'd have to be on this probationary license for a year and then apply to come off probation.
It's fine. Trust me, I'm not.
Your order would be almost identical to our prior.
I figured. This is my fault.
Because we've tried to be consistent in how we handle.
100% my fault. I own every single bit of that, and I will fix it.
So what Laura just handed me is a statement. What we've done in the past is a statement that says the applicant shall complete an addictionology psychiatric evaluation through the Indiana Veterinary Wellbeing Program within 60 days of the board's order.
Okay.
And, that's something we can put into, I would make a motion that we grant him a renewal on probation until his criminal probation is out with an evaluation within 60 days by the Indiana Veterinary Wellbeing Program.
I second that. That's good.
And then he can petition to come off probation when his criminal probation is up.
Fair.
It would be, basically a lot easier for the board to let the professionals make the evaluation.
Yeah.
Who seconded that motion?
Dr. Schnarr.
Thank you. You need that back?
Yeah.
Are we good?
Yep.
Is there anything else we need to add to this? Do we need Dr. Medlock to appear between now and?
so because we need to get the evaluation report first, Kelly.
Well, we would have that by the time we meet in July.
Well, he would have to come back in November, wouldn't he, for?
Yeah.
January.
Actually, October would be, both of these cases, our October meeting is before these criminal probations are up. So it extends it all the way out till a year from
No, I wouldn't do that.
Wouldn't do what?
Hmm?
Wouldn't do
I
what?
wouldn't extend it to a year.
Well, we have,
now. We have to do that.
for it to line up with
What
the,
I'm wondering about is, do we need to see Dr. Medlock between now and then?
I guess the reason I would consider it is
Get an update.
with, you get an update, but with, we'll have the evaluation, and then we, if there's any discussion based on the evaluation and based on if those findings lead us one direction versus another as part of the probation.
So I think,
What is it, that would be the September meeting?
You could require the personal appear here in like 6 months or.
right, what I was thinking was not this next meeting in April, but the one next fall.
July.
Yeah, we could put that in the order.
Or July, I'm sorry, I keep forgetting about the July meeting.
Yeah, we can put that in the order that here in July.
At that point, your evaluation's done.
Yeah.
and We check in and see how you're doing, and then following that, you can apply to come off probation.
Okay.
So you still get to practice and do what you've been doing, but we just need follow-up.
I got one little tracheal collapse chihuahua that needs his Vicodin prescription, so this is.
Well, we're not putting any restrictions, because there are cases where we put restrictions on that.
Yeah, no,
But there's not drugs involved here.
Wedgwood Pharmacy, don't get me started.
But since there's no drug diversions or anything, we don't need to do that. So I want to read that back real quick, Laura.
Yeah.
This would be the motion, I'm making the motion to renew license for Dr. Medlock with the following criteria.
Keep in mind, my notes are kind of. So it's a renewal on probation until a criminal probation is complete. He has to be evaluated have to be evaluated or an addictionology exam. I think that would be more appropriate. And require appearance in July.
I'd specify, continue the care as the addictionologist.
Do what?
I don't know that we can,
Till the
Required.
evaluation's
Yeah.
done.
We can't.
Ms. Kelly may tell us there's no reason for it.
Well, that's what I'm saying. We know her.
So we can't,
We can.
yeah, it's in the order that he's gonna get evaluated by that.
And then if she recommend.
Yeah.
If she recommends something, then we can always amend
Okay,
his probation.
you didn't say it.
But
Okay.
you've got the veterinary well-being program specified.
Yeah, it's going to be specified.
All right, okay, that's
And
what
that's
I'm
within
saying.
60 days.
Yes.
Mhm.
and one last clarification, every time when we're saying on probation, that is always indefinite probation.
Yes,
With the ability to come before the board
yes.
to ask, blah, blah, blah,
Yes.
or to withdraw.
Because we can't say a certain date because the
Yep.
court might extend it or,
Clarence, you up to speed on that?
Yeah, I got it all written down.
Yeah, okay,
yeah, they'll have them to me by this afternoon.
okay. All
Amazing.
right, so I would make that motion.
I will second it.
All those in favor of the probationary license renewal for Dr. Medlock, say aye.
Aye.
All those opposed? None so? Thanks, doctor.
Guys, thank you. And trust me,
Where
I'm already
is
doing
where
good.
is your practice?
Bloomington.
Okay, so
Bloomington Veterinary Hospital, come see us.
Just don't wear any cream and Chris.
Hey, I'm a boiler.
Good, all right.
You guys take care, thank you.
I guess I would like to have Dr. Marsh give his report. I know he has a meeting to get out to, and I'm sure you'll be
I
very.
apologize, I had another funeral come up that I need to go to, so I will be brief. A couple of items. One is, I did bring apologize for handouts, always, but I do have one for you folks here today. This, I thought it was important based on Laura's work with the renewal of licenses and registrations that we have data that we may not have actually reviewed before. So this is actually a breakdown of where your licensees are from for the DVM. It's presented in a couple of different ways. Laura's also will be taking a look at the veterinary technicians, but you can see that Purdue runs 50 to 60% of the licensees. And you got, and actually the bar chart on the second page illustrates it in a different way rather than a pie chart, but you can see where the Indiana licensees went to college for the veterinary degree. So Purdue, University of Illinois, Ohio State, Michigan State, and Ross is in the top 5. Then on to Auburn, Iowa State, et cetera. So now that we have the data, I've not seen this presented before the board, but Laura's been able to work with PLA to come up with this kind of data so we can actually see where your licensees are, where they went to college. And if you turn to the third page, it says where they are. And so you can see that over 2,000 of the Indiana licensees of the 2,686 are here in Indiana. And of course, you can see the surrounding states, Illinois with 116, Iowa with 101, Kentucky with 180, and Michigan. So most of them are right around us. Nebraska is not correct. It's 7, not 71. So I noted that, so we'll correct it on the next one. But you can see the distribution of where your licensees are located, literally from coast to coast, Alaska, Hawaii, Puerto Rico. So of the 2,686 licensees, they're distributed all across the country. I think we only have a very few states that didn't have licensees, North Dakota, New Mexico, Louisiana, et cetera. So there are a few sprinkled around that aren't in the United States or in a state in the United States. So it's just another illustration of where your licensees are located. The last page of that PowerPoint handout is where the RVTs are located by state. So you can see that almost 1,800 of them are here in Indiana, surrounding states, Illinois 37, 14 Michigan, 16 Ohio, and 14 in Kentucky. Then you go, Florida has 14, 8 in Georgia, et cetera. So you can see the distribution of those. By far the majority are here, 1,800 of the 1,900 are right here in the state. So it's a data set that we haven't looked at before to actually see, one, where the veterinarians receive their credentials. And Laura did a nice job. It comes in, it's a massive, she does a better job with spreadsheets than I do, so she could get that simulated. So you can see where they went to college and then where they're now located. And of course, all of those are not practicing in Indiana, but they may have gone to school here and they kept a license even though they now live in California or something, but they're coming back to you to get your license. The other item, and of course, the legislative session is ongoing. The the Vet Board has a bill this session. It's Senate Bill 104. It's authored by Senator Leising. It has 4 components to it, and I actually have got a handout on it. I think there's another to go around. I'd have to share on the far side. But there are 4 components, as you may recall, to the bill. One was that when the Vet Board was moved here from PLA, that the criminal background check authority didn't come with it. And so in other words, we're still working with PLA on that. This would be, do we get enough? Thank God, right enough there. So that will transfer that authority so that now we can receive those from the state police and others so we can expedite the new applicants. And of course, there's a background check for each new applicant. So that will correct that so that we can get that directly and expedite the license process. The second one is, as you recall in your license renewal, we had a data set that was asked for, just asks what you're doing with your license, what your intentions over the next 2 years, where your primary practice location is, et cetera. This data set is being collected from the human health professions. It has been for a number of years. It's never been done in the veterinary profession. And now we have that data set not only for veterinarians, but registered veterinary technicians. And we're working with the same group that does the data for the human health professions, the Bowen Center at IUPUI. And we're in negotiations with them right now on pricing, et cetera, so we can get that data assimilated They do a great job with dashboard work, et cetera, on what the kind of projections for at least the next couple of years, what the intentions are of veterinarians and veterinary technicians in the state. The second piece of the bill, therefore, would make that a permanent requirement. So on each renewal cycle, you'll have that same set of questions or similar ones, so we can keep that data set going. So that's the second piece. The third piece is a clarification of the Indiana Controlled Substances Act, so it's in compliance with the federal law. Federal law was changed in 2014, 10 years ago, under the Veterinary Medicine Mobility Act, so that, for example, if you're doing mobile practice or farm practice, the way that was originally set up, you'd have to have a CSR for each location. And so under the Mobility Act that was passed 10 years ago in Congress, that's no longer required. And so this would clarify our state law, and appreciate the reach from PLA's Pharmacy Board, et cetera, to make us aware of this change. Laura's done a lot of work on this. The other piece of it is, if you happen to see, for example, you're in Ohio and you have an Indiana license, the CSR that you have in Ohio will suffice for Indiana. So that will cover that. So that was clarified in that federal act 10 years ago, but it was never clarified in our law. So that'll be clear moving forward from here. The last one in that set is that you may recall if someone is actually has an expired license in Indiana for 5 years under the veterinary code, then you basically have to start over. We don't see that very often, but the other health professions provide latitude to the boards to determine that, even if you're out for 3 years. So that will modify that, and Laura can give even further explanation on this, but this would be make us more consistent with the other health professions about someone who lets a license expire. Haven't seen that very often. We don't see those too often, but I do recall one several years ago. Rick Kirsten appeared before this board, and unfortunately he let his licenses go, and he was working for the federal government, so he didn't need a license technically. But his wife was diagnosed with a terminal illness, and she had small children, and he said, I'm going to have to supplement my income. I need to practice on the side. Had no license, and he let it go for a number of years. He actually sat for the national boards again after being out of school 20 years and passed them, so he could get a license again, so he could take care of his family. So this would give the board the latitude to decide, rather than just a hard and fast no, start over. Then you can make a judgment on what's presented before you. So I wanted to make sure you're aware of those data sets that are out there. Laura will talk more to you later about the continuing education issues that as she goes through the auditing process. A couple of things on the animal health side of the house. My report is in there as well. It's the same report I've given to the Board of Animal Health that met just a couple of weeks ago, so you can take a look at that in there. A couple of items since even that report. 2 nights ago, we diagnosed highly pathogenic avian influenza in Davies County. So I see heads nodding, so you've seen the reports on that. The flock has been depopulated, and we're already working up that situation. The first case we've had in a while, although that virus is literally from coast to coast. California to Maryland, it's all through the hemisphere. Some of the reports that are coming in, it's the same virus that's killing elephant seals in the Antarctic. So it's a tough virus. So we've been able to dodge it here before, but we ended up with a turkey flock with the disease here a couple of nights ago. Hopefully it has been depopulated, and hopefully we can get ahead of it so we don't have continuing spread in that part of the state. The other thing is that it's quite unusual. For the first time in 20 years, we had a skunk diagnosed with skunk variant rabies in Clark County, Indiana. That's the first skunk variant rabies we've had in over 20 years. Now, they have it in Kentucky, and so we had a call last evening with CDC and our health department, the Department of Natural Resources, and a whole host of folks. So we're putting out a statewide notice just so people are aware of it. And no additional things at this point, but at least we're working with local animal control officials in the area, shelters, veterinary community, et cetera. So, and I know there are vaccination clinics that are hosted in some parts of this other part of the state, but we want to make sure that this is the first time in 20 years it's been diagnosed. On the other side of the river, looking back over the last 4 years, for example, they've had dog rabies in Kentucky, and every one of them's been a skunk variant. And so they have it south of the river. So I don't know whether it walked across the bridge or exactly what happened down there. I don't suppose we found the only one. So there's likely others down there. And so I just wanted to make sure, so we're sending out an alert to the veterinary community and the animal owned community about that unique diagnosis in southern part of the state. So those are some of the things I had.
Was there any human exposure on that?
Not in this particular case. It's, we've had a lot of questions, interviewed the owners. It's in a rural area of Clark County down there. Of course, that's right across the river from Louisville and Jefferson.
Was it a pet?
I'm sorry?
Was it a pet skunk?
No, it was not a pet skunk. Although, interesting, if you bring it up, there was a pet skunk facility in Michigan that had rabies in it. And so that's been in just the last few months. So there's been a full investigation of that as well. So, but this is, as far as we know, a wild skunk that mixed it up with a dog down there in the county.
Okay, so it was a dog exposure.
Dog exposure. Fortunately, the dog was vaccinated, current, et cetera. And so the skunk was sent in and tested, found to be positive. Then they had to do a further analysis to determine which variant we were dealing with, and it turned out to be skunk variant in this case. But that's the only skunk that's been even submitted for testing in the county. So we're not seeing skunks submitted. I live in Hamilton County. I don't often see skunks, so I don't know how prevalent they are in the southern part of the state, but you see several of them down there. But nonetheless, now we have skunk variant for the first time in 20 years down in that part of the state. So we'll send the notices out.
The CSR thing, I had somebody in the veterinary field asking me, and I was going to check with IVMA and whatnot, but since you're talking about this, their issue, they knew someone that lived in Kentucky, relief veterinarian, working in Indiana. And so their issues, they were trying to get their license renewed in their CSR. And because they were living out of the state, but working in the state, the CSR thing, which I think is kind of what you're, so as of right now, that's an issue, but when this goes through, that will be resolved. Is that?
That's
how I should
correct.
take that?
One of the challenges that we've had, and it's been a perennial challenge, is you had to have an Indiana address to get the CSR. This will correct that.
And that was the second thing I wrote down was that, you know, they had no practice address. So what did they put down? And every time they contacted PLA, they were,
It throws a wrench.
there was no answer.
Right. And I didn't know.
So
this was
until
an
now, or until this is done, they're still SOL?
They're still out. My guess is that, you know, let's be honest, it's been going on. I mean, they've been practicing in Indiana. But yes, since he didn't have a location in the state, it prohibited him from doing it. But this Mobility Act will correct that. So we're hopeful by July the 1st, we get this bill passed, that will be clear.
That would be when it gets signed.
July 1st effective date.
Okay, thank you.
So it passed out of committee. It's up for second readings in the Senate. The other bill that I want to mention to you, even though it may not be directly, is xylazine. And so the xylazine bill has been significantly amended. It's been amended to basically coincide where the AVMA has been and with the bill that's in Congress. So it would not schedule it, although the first proposal was to make it a Schedule 2. So that's all been amended and stricken. It's new language. It does not schedule it for veterinary use. And so that bill is passed out of committee and it's on its way to the House.
They got tired of hearing from us.
So
All those emails we kept sending
that's-
about.
so there'd be no logging and reporting to
That's
the
correct.
inspector, any of that stuff?
That's correct. As a matter of fact, I'll be honest, if that bill passes, I think it's one that needs to be shared with other states because the scheduling in other states is very broad.
It's
And
not,
It's not
some's
necessary.
2, some's 3.
Yeah, it's all over the board.
It's ridiculous.
And so it's really unfortunate because I would fully appreciate the challenge with xylazine and fentanyl and overdose issues and deaths associated with it and what have you, but they're not getting xylazine for the veterinary community. And so in visiting with the legislator, she understood and was willing to amend. So it's been significantly amended and I think it's a good bill.
Did I misread something? Was there something there that said that even on farm and horse facilities, that it doesn't have to be under the control or presence of the veterinarian? Did I read that?
It should be.
I think there was a
because it's-
statement in there that said that farm owners or horse owners could not have it, or they did. I didn't realize they had it. I thought it was only.
I thought
But it's still, it's on the use or order of a veterinarian. I mean, it's a script product, so that hasn't changed. Now, it may be left to it, you know, on script, at a stable or something of that sort.
I think the way I interpret it is like a bottle of xylazine could be in a horse barn.
Yeah.
Not directly in the hands of the veterinarian, and the horse owner would still be okay.
I suspect that's, yes.
That's
That's what I
read.
thought I read.
I think you're correct.
That part surprised me a little bit.
And, yeah, there's a legislator or two that has some staples, so I suspect that's why they showed it.
Yeah, okay. Because they didn't want to have to call the veterinarian every time they wanted to use xylazine.
Right.
I thought I read that as part of the amendment.
All right. I think that's all I have. I apologize.
Thank you, Dr. Marsh. We'll let you. If we have any questions, we can grill Laura.
I think it's in good hands. I hate leaving you with we can handle this electronically. You're also familiar with the placemat.
Yes.
Just as long as the treats stay. I mean,
No, I'll leave those here.
I don't want to,
I'll
I
just
just
ask
want
for
to
the
be
treats back.
absolutely clear. Tell me the truth.
The placemat, I go to meetings now and I say, no, Brett, you did bring the placemat. Yes, I brought the placemat. So I won't go over all of it, but what I will share with this board is that we're proposing to produce a similar set, like a placemat with this kind of data. So the vet board will also have a placemat like, but you have a set of data that's never been distributed before. So we'll be doing the same kind of thing. But again, I won't go over here because we've got folks waiting in the gallery here and I won't do it. But there's a lot of things going on the Board of Animal Health. And I think it's important that the vet board have its placemat too, or whatever you want to call it, that there's a lot of data that, and with Laura's help, there's, the charts that you have before you here today, those are the kind of things people don't know. I mean, I had no idea. I've sat with this board a number of years. I mean, I don't know where all the licensees are or which college they went to or anything else. And I think it's important for this board.
I was amazed at the number of technicians that are licensed in this state.
There's a lot of registrations big here.
But we don't know where they are, like you haven't, well, we don't know where they got their education, I guess.
I'm working on
And
that.
she's working on that. Yeah. Laura's done a wonderful job to get this for the board meeting today, because it's, I mean, there's thousands.
There's almost as
There's a lot
many
of
technicians as there is veterinarians.
But we'll be
There should
doing
be
more on that.
Many
Should be more.
Should be many more.
There's not as big a spread as there used to be.
Right.
Dr. Marsh, there's a thing on the placemat about the staff additions. Just curious, are all of the district, state veterinaries, are they all filled now?
They are.
There was a time span you were still looking at.
That's correct.
Okay.
We had a slot that was open and we hired Dr. Solomon, and so she's in place in Southwest Indiana. So all 10 of those are in place.
Okay.
We hired a veterinary epidemiologist, Dr. Trainer's on board. We hired a poultry health specialist, Chelsea Letterman. The poultry veterinary slot, that market's so strong in the poultry community, I'm having trouble competing there right now, so we're still working on that.
Thank you, Dr. Marsh.
Well, thank you, and you're in good hands. I'm going to push things. All right, thanks.
I think we'll do the 2 administrative hearings so our court reporter can be released from duty.
Is Brittany here?
Is Brittany in the hallway?
I think so.
Sometimes we need to go retrieve first. We wanted to do that so we could release their court reporter. Do you want to start with
Let's, I'll let her.
Okay.
Oh, perfect.
Sorry, where are we at?
We're skipping to administrative hearings. For me? Yes.
You're up.
Which one did you want to do first? Miranda Kellums or Teresa Katina?
It's up to you. For Teresa, that order was on the board's own motion for failing to appear repeatedly. I have nothing to contribute to that hearing.
Okay, then let's do Miranda first.
Right, which one?
Miranda.
All right. So start with this script, correct?
Yes.
Okay.
And you just,
Swearing,
yeah.
where's
second page.
okay, all right. Okay, this is an administrative hearing being held in person this 25th day of January 2024 at 1202 East 38th Street, Suite 100, Discovery Hall, Indianapolis, Indiana, 46205 at 11:21 a.m. local time. This hearing is being conducted pursuant to the laws of the state of Indiana, found in Indiana Code 4-21.5, before 5 members of the Indiana Board, 6? Only 5.
Oh.
Before 5 members of the Indiana Board of Veterinary Medicine in cause docketed as administrative cause number 2023 BB0013. The notice of time and place of this hearing was mailed to the respondent as provided by law on December 5th, 2023. The purpose of this hearing is to consider the motion for cease and desist of the respondent's actions as filed on November 14th, 2023. My name is Dr. Paul Clementi, and I am serving as hearing officer for this board. The following members of the board are sitting with me on this hearing: Dr. Kelly Peelman, DVM, Dr. John Schnarr, DVM, Dr. Steve Sunbury, DVM, and Natalie Goodwin, representative for the public. At this time, I will request that any board member who feels that he or she cannot give this individual a fair hearing and render an impartial decision to remove himself or herself from the hearing. So, where do we swear in the court report? Is the respondent present?
No.
No. Okay. So we need to swear in our court reporter. Will the official reporter designated for this hearing please stand and be sworn? Please raise your right hand and state your name.
Mary McCarty.
Do you solemnly swear that you will keep complete and true notes of all that transpires in this hearing and prepare a complete transcript thereof from your notes and faithfully perform all duties imposed upon you as an official reporter under the laws of the state of Indiana?
Yes, sir, I do.
Are there any witnesses here to be sworn in? Okay, can we have an opening statement?
Yes, this is, I'm Brittany McMahon from the state of Indiana. On or about October 3rd, 2023, the state served a motion for order to cease and desist by U.S. mail to Miranda Kellums at 3225 Harmony Lane, Charlestown, Indiana, which is the last known address. This document was never returned to sender by the U.S. Postal Service as a bad address. On December 5th, 2023, a hearing notice for today's hearing was served on Ms. Kellums by the board at the same address. And I have communicated with the board with exhibits for today and copied Ms. Kellums via email. That email address was not kicked out as a bad address, and she did not respond or reply to the email in any capacity. Because Ms. Kellums has failed to appear for today's hearing after being provided with proper service of the hearing notice and other communication, making her aware of today's hearing, the state requested the board issue a notice of proposed default.
Anybody have any questions?
Do we know where she is?
Need for discussion?
Or is it, well,
So this is the case where the veterinarian had dismissed it.
No, she doesn't have a license.
Right, but she represented herself as having a license to her employer.
Complete with documentation.
Complete with invalid
Invalid.
documentation. And then was was made aware to the veterinarian that employed her that she was not in fact credentialed, and then he dismissed her from his employment.
Is the hearing closed, or can I just make a statement?
No, we didn't close anything yet.
Dr. Hussey and his office manager, Aubrey Tennyson, were here today via Teams in preparation to testify if Ms. Kellums appeared. It is my understanding from speaking to them that Ms. Kellums is still in the Corridon area and working at a vet clinic in the area. Unknown what her job title and duties are there, but she is still in the community.
But not responding to you.
Correct. She never responded to the consumer complaints either.
Well, since there's no respondent here, then we can move forward, correct?
Well, the state moved for a notice of proposed default, so you can discuss.
We can go ahead and move for that.
Right. So is there need for any more discussion? Everybody saw the notes and, okay. So we can close the hearing, correct? Okay. So neither party, you don't need to make any closing statements. Ms. Kellum's not represented or here. So these proceedings according to notice are hereby concluded. The cause is therefore adjourned until further notice. So we need to make a motion to issue an order of default.
And notice proposed default.
Notice of proposed default.
Then she'll have 7 days to explain why she wasn't here.
So I would make that motion that we issue a notice of proposed default.
Second.
To Miranda Kellums. All those in favor of that motion say aye.
Aye.
All those opposed? Being none, this case is closed.
Thank you.
So we're going to
Very
move
good
on.
question. Hold it. Just a discussion point out after the fact.
Oh yeah, does that cross over to criminal at any point, where that,
Yeah, if we actually,
obviously, like, if we continue to do that, but like someone still practice it, or has like provided false documentation or something? Like, is there additional steps taken outside of our scope?
once we issue the order to cease and desist, and then if she continues, then it can be handed over to the prosecutor's office.
Okay.
There can be an injunction.
Pretty.
If you're just gonna keep.
But first things first, we had the proposed default, then if there's no response to that, then at the next meeting, we can issue a cease and desist.
But we have to still wait till the next meeting to do that?
But we have no idea, she's still living in Corridon area, but we don't know where she's working or what. Do we know the practice where she's working?
That would not be something that I would admit
Yeah,
at the hearing because it would be hearsay.
I don't think she can tell us that.
Okay.
We'll have to trust the Attorney General's investigative team to pursue things
Okay,
further.
all right.
But I went ahead and filed this request for cease and desist because of the obviously the facts, but because she's also still in the community, I'm gonna move forward with the order, even though it's been a year.
We can't even
Oh, can,
talk to her quote unquote employer and warn them.
are we able to, are we already done with this, or was there something else we could do?
I think that's the stuff we had to
This
take.
is all we can do
This
with
is all we can do
this
right
case
now.
right now.
To get to the cease and desist?
Right.
Yes.
Yes.
Okay.
Yes.
Yeah, sorry, I forgot.
Quite honestly, she doesn't have a license for us to discipline. So we have to issue a cease and desist for unlicensed practice.
Didn't know if there were like emergency
But we
orders.
can't do that until we admonish her for not showing.
Able to review it, because
Okay.
that seems like
I
a
mean,
danger to the
It
public.
would be up to you guys. You could have an emergency hearing before the April hearing. That is up to you guys.
So like if we got.
That would be a separate.
What?
That would be an additional hearing, is what you're saying.
Yeah,
We
like
want to speed up, okay.
we would have to wait the 7 days, I'm assuming, and then like theoretically take action?
This is what bothers me.
Can we
Which
do
is
that
the next
virtually?
meeting.
Yeah, I don't know. Can we do that virtually?
Which is April.
I don't remember what our
With-
rule was on.
With the new rules, virtually, are we
Is
able
the
to
hearing
have?
closed? Sorry, I guess I should.
Yes, somebody's got to be here physically, and it can't be me.
I'm close.
So am I.
So I'd have to look back at the electronic meeting policy, to be honest, because we passed it last year. But I can summarize it for you guys, and then if we want to hold a meeting, you know, it has to be properly noticed, so it's got to be at least 7 days before we have the meeting, and
We need
No.
to close the hearing, sorry, I realized
I think it was closed.
it was already closed.
So
I didn't know if I was just rambling on and.
it would be interesting to find out, based on those new rules, what we would have to do if we wanted to do that. Having said that, if she is somewhere else practicing, possibly, we don't know what, is she practicing as a registered veterinary technician
Yeah.
or an assistant? And
Right.
so then we, like you said, well, we wouldn't really have any, that would have to come from.
Yeah. She doesn't have a license to discipline. It's strictly a cease and desist order at this point.
So for that reason, an extra meeting probably is not
Right.
something that I would think we would, for this case.
No, that's.
But other ones we may want.
And quite honestly, her new employer may or may not know the situation, and she could be working as a veterinary assistant, doing the same task, which has always been a point of contention with our VT community. So let's move on to Teresa, am I pronouncing this right, Catani? Catani.
Don't know how you pronounce it.
Well, that's the way I'm going to pronounce it, Teresa Catani. This is an administrative hearing being held in person this 25th day of January 2024 at 1202 East 38th Street, Suite 100, Discovery Hall, Indianapolis, Indiana, 46205 at 11:32 a.m. local time. This hearing is being conducted pursuant to the laws of the state of Indiana, found in Indiana Code 4-21.5, before 5 members of the Indiana Board of Veterinary Medicine in a cause docketed as administrative cause number 2016 VB0010. The notice of time and place of this hearing was mailed to the respondent through the notice of proposed default as provided by law on November 14th, 2023. Notice was given to the Office of the Attorney General. The purpose of this hearing is for a respondent to show cause why her registered veterinary technician registration should not be suspended or subjected to further sanctions. My name is Dr. Paul Clementi, and I am serving as hearing officer for this board. The following members of the board are sitting with me on this hearing: Dr. Kelly Peelman, DVM, Dr. John Schnarr, DVM, Dr. Steve Sunbury, DVM, and Natalie Goodwin, representing the general public. At this time, I will request that any board member who feels that he or she cannot give this individual a fair hearing and render an impartial decision to remove himself or herself from this hearing. Since the respondent is not present and we've already sworn in the court reporter, are there any witnesses to be sworn in?
No.
No witnesses to be sworn in. So we will let the Attorney General make their opening statement.
Thank you. My name is Brittany McMahon. I'm representing the state of Indiana. In July of 2023, at the regular meeting of this board, the board issued an order to show cause based off of respondents' failure to appear personally based off of a prior probationary order that the board had issued. In October of 2023, at the regularly scheduled board meeting, the board issued a notice of proposed default. Was it October or November? November, it was November of this year, sorry.
November 2nd.
November 2nd, the board issued notice of proposed default. Ms. Catani has not responded to that. She is not here today. Therefore, the state requests that the board issue sanctions on their original order to show cause as they see fit.
So since the respondent's not present, do we need any further discussion? This has been going on for a while. Pretty much as near as I can tell for well over a year, our attempts to resolve this have been thwarted by no-shows. I think it's been more than a year.
Do we need to at least discuss, if nothing else, for Dr. Pillman's knowledge, what got us to this point with the initial?
Well, what I had in my notes is Teresa was on probation for drug issues that related back to 2017, 6 years ago. And there was a failure to show up for follow-up appearances, and she didn't turn in the required paperwork for her probation, and those sorts of things were all ignored. Like I said, from my notes, I go all the way back to 2017 on this. So it's 6 years going on 7 years, basically. She's failed to respond to the board and to show for any hearings. I don't believe I've had her here for anything. Except for the original case, I'm sorry.
Yeah, the original case was opened in 2016 for the cost numbers, so it's been going on a long time.
If my memory serves me, I believe that the board placed her on probation either at an initial application or a renewal, and that the state wasn't involved in litigation when she went on probation.
Yeah, I
That's
think
my
the
understanding.
probationary order was maybe dated 2017, and it was in that 2016-17 timeframe. But if I remember the original case, it was a drug diversion type situation. Controlled substances, I should say. So, since there's no further discussion, then these proceedings, according to notice, are hereby concluded. This cause is therefore adjourned until further notice. So we would make a motion for.
To find her in default first.
She's already been found in.
She's already been found in default.
Okay.
This is,
The notice of default was sent in November.
Yeah, that is the notice of proposed default. So and then she didn't explain why she wasn't here. So now I think the board needs to go ahead and find her in default, that order, and then issue the sanction, which my recommendation would be to revoke her license or suspend it. It would be another option. And revoking the license is for 7 years.
because
That was my question.
I think
Does she have an active license now?
Well, she never renewed, I don't believe.
Well, that's what I'm getting at.
I think it's still technically active until March or April when they renew.
They've already renewed, right?
Okay.
Let me check. I think she's expired.
Well, is she?
Yeah, she's on probation expired. Her expiration date was 2024, January 1st, 2024.
But she's never appeared she's never appeared to
With the
update
probation.
us on her probationary order. So at this point, if I understand it correctly, we've done like 2 defaults, and
Yeah, we
this
issued,
is the third time.
the notice of proposed default, I believe, was issued on November 2nd, 2023. She didn't respond. So now we find her in default.
And issue the sanction.
Yeah, and issue the sanction.
So we can do both those.
Yes,
We can sanction an expired license.
I think so.
Yeah, because they changed the statute
Yeah.
based on that Derek Peterson case.
Do we know,
So
do we
we're
know
back to
where
that
she's working and then
highlighted paper.
I guess if she's not, if she didn't
Right.
renew,
The three things we can do.
if she didn't renew her license, my guess is she's probably not
that
working
doesn't
in as
mean
a vet
anything?
tech at
It's been
least.
going on for 7 years. Sorry.
She could probably still.
But if she goes somewhere
work
else,
As a vet tech and if nobody checks up on her.
yeah, and if she works somewhere else or goes to another state, there's a possibility that, like you said, if she doesn't even report this, they might not find it. They might not find a revocation as well, but more and more states are finding discipline. Clarence is right, revocation is only good for 7 years, suspension you can do for longer. But I think they frown upon that, like suspension
Yeah.
for
I don't think you can.
99 years. You know?
You can't do,
Indefinite.
you
Like
can't-
circumventing the
you can't
intent.
do an indefinite suspension is what you're saying.
Yeah, I think 7 years to be the max, and then they're allowed to apply again.
Yeah.
So there's really no difference between indefinite suspension and revocation at this point.
Well, we suspended it for 7, yeah,
We
That
put
doesn't
her on
matter.
probation and spent 6.5 years.
Like on the suspension, you could make it 2 years if you want to be a little more lax, and then she could apply after 2 years. The revocation is just a harder punishment, saying you can't apply for 7 years, which is the max.
Then she would have to come before the board if she tried again, right? Because of this process check.
Yes,
So we still
yes,
have
there are
to
flags
okay
in our
that.
system, yeah.
Then we can choose.
I think it makes more sense at this point to do the revocation. Normally, I wouldn't say that, but I think.
She's ignored us for 7 years.
Right. I think I would make a motion to revoke the RVT certification for Teresa.
Okay,
Do the
yeah,
default.
can we do the motion for default first, to find her in default, and then do the motion for revocation? For the record.
I would make a motion, we find Teresa Catani in default
Okay.
and revoke her license for 7 years.
Any second?
Second.
I'm gonna give it to Dr. She's
All those-
allowed to have some.
All those in favor of finding Teresa Catani in default and the revocation of her RVT certification for 7 years, all those in favor say aye.
Aye.
Aye. All those opposed? Okay,
Thank you.
this matter's closed. I got papers for you.
I'm not leaving.
Oh, you're still here?
I'll do it for it later.
Okay. Okay, so our next order of business is to take a look at VT&E retakes. I believe we have 4 candidates to petition for retaking the VT&E for the 4th time. First up on my list is Justin Carr. Hey, Justin, thanks for coming down and speaking with us. Kind of fill us in a little bit what's happening.
Yeah, so I I graduated in September of 22, and I took my test, I think December was the first time, and I just like absolutely freaked out. I have horrible test anxiety, and it did not go well. So I ended up getting a tutor for 7, or no, not that time. I took the vet tech prep that's pretty popular, and I read a bunch of books, and I studied really hard, and my scores improved a little. And then I got a tutor for about 7 months, and I took it this last time in December. And my scores improved, but I didn't pass. But prior to taking the test, I had signed up to take it online, maybe to help with the anxiety. And I had a bunch of issues with like my computer, it wasn't letting me in. I had called like tech support, I think 3 times, trying to just get in to take the test, and that took probably 2 or 3 hours. So I was already an anxious mess thinking I wasn't gonna be able to take the test. My score improved, but I still didn't pass, so.
Well, you did, from my notes, the 2022 was a shipwreck. That was a 200
It was so bad,
for
yeah.
425. And you improved a little bit in the spring of 23 up to 275. And then 328 this past November, that was an improvement. I kind of looked between the lines, and it looks like pharmacology's been a little bit of a struggle in the laboratory stuff. So, you know, for taking this the fourth time, I'm not sure how you go about focusing on those areas, but it seems to me like that's kind of reared its ugly head, the pharmacology and the laboratory stuff.
Yeah.
On the last two takes. Am I right about that?
Yeah. It's, yeah.
But this last time, that's a big improvement from the original 200 to 328.
Yeah.
But you're still 100 points shy.
Away, yeah. And I'm working with the same tutor. I just started like a week after the last test. And I don't know when I'm going to take it again, but I've been working with her and trying to really focus in on pharmacology and lab to hopefully get.
I'll ask John's question for it. Where did you go to school?
In Foster, Ashworth College. So
Where?
it was all like online aside from my internship.
I could,
Can you repeat the?
Penn Foster,
Oh, okay.
Ashworth College, yeah.
the biggest one.
And are you currently working in the field as far as an assistant or anything? What's?
Yeah, I'm working as an assistant. It was like right before I graduated school. I started at a VCA on West 86th Street, and then 7 or 8 months ago, I transferred to a different VCA where I've been since. So just currently.
What are your daily tasks at this VCA?
I do like appointments. I'm helping out in surgery, like helping monitor recovering animals. Mostly just like appointments and whatnot. Calling back labs, refills, things like that. So.
Does anyone mentor you there?
Yes, I have it's my technician supervisor. She's been mentoring me as far as like helping me study, asking questions. She did all of my training, and I work with her every day.
So did you take the VT&E prep course as well?
Yes, I've taken the vet tech prep, and then I'm in a crash course with a lady named Beth Ann. I found that on like a Facebook support group. I'm taking her crash course, on top of working with a tutor quite a bit to try to improve those scores. I've done a lot.
So obviously your certification's important to you, and
extremely, yeah.
Probably get you a bump up in position and salary and so forth.
Yeah. I paid my way through college on my own. Thankfully, Penn Foster wasn't like crazy expensive, but I worked my tail off just to graduate, and then obviously failing 3 times wasn't ideal. So I've just been doing what I can to try to pass, but.
What does it look like when you take this online now? How do you get proctored for that?
I hadn't taken it online before, but there's like a little, like in the corner, like a little box basically. You can't see the person, but it was like, I thought when I took it online, I would be able to like ask myself questions out loud. That wasn't the case. She like dinged me, I guess, for speaking, and that was a big thing. I was like, it just made it a lot more difficult. I thought I was gonna get kicked out for like cheating basically, but they basically, anytime they have a question or they think like they're saying something to you, it's like they pause the test completely and have you like message them back basically.
So they're monitoring you through your computer.
Mm-hmm. Yeah, it's like kind of like FaceTime, I guess would be, or Skype,
yeah.
Essentially, yeah.
So you have the proctor picture up in the.
Yeah, they're just like watching.
So they sit there and watch.
Yeah.
How long was that?
I took the entire time just to try to calm down. I took the whole 3 hours just to, yeah.
If I'm not mistaken, you can ask for, if you have test anxiety, you can ask for different situations where you potentially could have a longer amount of time possibly. And I guess from what I'm hearing from you, you might benefit to see if there was a place you could take it with a live proctor somewhere where if you wanted to talk yourself through the questions, then I think that, I'm not leaving them straight.
Yeah, they have testing accommodations.
Okay, because
So
I was
you may
gonna ask, like,
wanna
is
look
that a
into
thing
that.
I can do if I'm able to take it again? It's like,
Yeah,
it's a lot.
if the board approves you to retake it, when I send that letter, I can also reach out to them and let them know that you would like to request special testing and accommodations due to anxiety. They might need a letter from a physician,
Okay.
but that's not.
Is Penn Foster all online?
Yes, like all of the class work essentially is online, and then,
How did they do testing?
I took just from home. There's not like, it's not proctored or anything, so I was able to ask myself the questions out loud, and I did really well in school. I just, for whatever reason, when I'm in like the testing facility, I just freak out for some reason. Obviously, I did a little bit better when I took it from home, but it still, yeah, portal testing, so.
I would make a motion that would allow a chance at taking the test.
Second.
Motion's been made to allow Justin to retake the VT&E for the 4th time. All those in favor say aye.
Aye.
All those opposed? 5-0. Okay, Justin.
A reminder, isn't there a clock? Because we had to have somebody, we
Oh.
approved and there's a period of time since if you didn't know. It's like, is it 1 year or someone had to come in like
It'd
6
been like-
months ago?
It'd been like 3 years or
Yes.
something, hadn't it?
Yes, but
Basically.
he just took his last test on November 20th.
November
I know, I thought from the time we approved the 4th retake, because somebody had to come back in and get our approval again, because we'd already approved the 4th, but they didn't do it in a certain.
Oh, that's right. That was like 3 years, wasn't it?
And I
It was,
also,
but I thought it was a shorter amount of time that I didn't realize that they
It's a
had.
pretty,
Was it?
I also.
I
felt
only
like-
say it since you said you didn't know exactly, because a lot of people say I know exactly which one I'm asking to take again, but just
I-
don't wait too long, because you have to come back again.
Oh, okay,
I also had the feeling that was, like, maybe it wouldn't get, like, maybe it kind of got lost
Okay,
where it was, and now that
Yeah.
we're here, I'm much more
I just wanted to
confident it
make
won't
sure.
get lost, but
Okay,
yes, it's still
Aw,
good
that's
advice.
and it shouldn't be a problem, I just would hate for you to have to come down here, and then if you want to study for 6 months or however long,
Yeah.
and then say,
Yeah.
oh wait, I have to ask again.
Justin, this should ease all your anxiety,
Yeah.
to know that we're on top of it.
We are on top of it.
Just don't wait 3 years to take it.
No, I don't think.
No, Justin and I have been emailing back and forth and staying in touch, so, if you're fine with me reaching out to VT&E and having a contact get in touch with you about accommodations,
Yes,
I can pass that along?
Yes,
Okay.
thank you.
Let me put your mind at ease a little bit, okay? One of our members of the board was in your situation, outstanding veterinary technician. Now, she would tell you that because she's told everybody, okay? So I'm not revealing any secrets. So don't get overly anxious. Don't give up. I admire your fortitude, okay? Just keep plugging away. This isn't a final as well. I mean, we have approved people past the 4th.
Okay.
So I don't want you to feel that pressure like this is it. If I mess this up, I'm done.
Okay.
So I'm trying to help relieve your anxiety a little bit. Okay,
Thank you.
so good luck.
Hopefully I don't have to do this again.
Okay.
Okay, thank you.
Yeah, with statute, I don't see any time limit. I think the IPLA director just put the person back on because it's been 3 years in that situation. But I don't think
Okay,
it
cool.
actually-
Yeah, I just wanted to make sure there wasn't,
I knew it was a long.
when it happened, I was like, oh no.
Well, good luck to you.
Thank you.
Already, I don't know.
So next up is Mary Beth Moffitt, correct?
Moffett, yeah.
Yes, thanks, Mary Beth, for coming.
Thank you for seeing.
So Mary Beth, you can fill us in a little bit on your situation with the testing. I believe we went from 290 or 253 to 291 and 356 last time.
And
So
then
you
I
did
scared
improve.
myself.
But you did improve.
Yes. I was very proud of that score. I want to point that out. So I went to International Business College, the Vet Tech Institute. I've known I wanted to be in the veterinary professional field in general since I was in elementary school. I was that kid, I want to be a vet. I don't want to be a vet anymore, sorry. But I learned what a vet tech was, and I was like, that's exactly what I want. I want to be hands-on. So beginning of my senior year, I learned I could get into a program that was only 18 months in Indy. I was like, sign me up. I signed up for the summer course. I took exactly 2 weeks of summer vacation between high school and then I started college. Right when I finished college in, I believe it was December of 15, I took a few months off to get established in a veterinary hospital as a kennel attendant, and to also take time to try to set myself up before I took my first VTE, which I believe was in March, and I want to say that was in 16. I could be wrong on these dates.
Yeah.
It was a while ago.
I had down December of 2016.
Yes.
July, we have the first one.
July.
Yeah. So I took the first test. I did the normal standard thing, thought I was a hot shot out of college, didn't study the appropriate amount that I should have. And sure enough, it bit me in the butt. The second time, there was a vet tech at the clinic I was working at who was like, let me tutor you, let me help you, like, let me get this figured out. And I was like, yeah, let's do that. I went in, I felt okay going in, and then the moment the questions started, I do suffer from anxiety and depression, and I decided to let it take over that day, unfortunately. So I let myself get in my head. I went back through and I double checked some answers, and I think I switched some that were actually correct. And I hurt myself essentially. And then I left that practice and went to a BCA, and I felt immense support from the staff there, enough that they were like, why don't you try it? You have a third take. Let's go for it. So I did that. I did the VTE prep online course, which helped so much. If you do approve me to retake the test, I do plan on taking that course again. Hopefully a longer version of that course. I took a pretty short version. So I'm hoping to take a slightly longer one. And then, so with that course, and I had techs at the time helping me, supporting me, throwing questions my way. I would come in on my days off and like just shadow them to go over anything. I did that, and then I took it again, and I felt very good on that test, but I was so disappointed in myself for failing a third time. I felt like I failed the community as a whole. I felt like I failed my clinic.
Sorry.
I recently left BCA due to a bunch of staffing changes at my home, at my original clinic. I now work at an amazing clinic. It's Creekside Animal Hospital in Lafayette. I have never felt the support since pretty much originally I was settled on just being an assistant forever. I don't want to be an assistant forever. I want to be a technician. It's my goal. I do plan on, if I can become a technician, I want to even continue that and start specializing in something. I've always had a peak interest in nutrition and things like that. So I have a plan, but unfortunately I let myself psych myself out and be too hard on myself. I am now in therapy and take medications. She actually did recommend, between her recommendation and my current staff that I work with, I chose to come and petition myself to take it again instead of just saying that, oh, that's it for me. So I've already started studying. I've bought all new updated books. I have all the new updated textbooks even. I've paid out of my own pocket. I plan to, again, retake the VT&E prep course. My doctors and my technicians have already said we'll set up study dates once a week that you are required to come to. We're gonna get it set. My goal, if I do get approved, is to take it this fall and kind of go from there. That way it gives me some time to prep. My therapist did mention seeing about testing accommodations because I never even thought of that. So upon again being approved, I have a whole sheet that I forgot at home. But I did plan on seeking accommodations, whether that be, I know a girl in my schooling that had taken it, she had accommodations to just have a pre-approved playlist of like just soft instrumental music like playing in the background, because I freaked myself out with silence. So I think it was just too quiet in the room for me. So it's kind of where I'm at. My current clinic, I am an assistant, but they do assistants based on levels. I am a level 3, working on being a level 4. Level 4 is our highest, and they're the one step below a technician. I'm able to draw blood. I'm able to do any tests and things like that in the office. I mainly work with appointments. I primarily help the doctors in the rooms. I take histories, restrained animals, but I also help get surgeries down. I do help if they are in surgery and they just need extra hands. I am qualified to go in and do that due to their testings. And they also require CE, so I'm really excited because I haven't had to sit in on CE for a while, so I'm really happy about that. And I ramble a lot when I'm anxious, so I am so sorry.
That's fine. I wasn't going to cut you off. I admire your fortitude. And I'm sure Dr. Schnarr and I both remember when Creekside Animal Hospital was a gas station.
Yeah.
Quite the clinic now.
Yeah. I would say I bounce between both locations.
You know, I asked this of Justin, were you able to, we didn't have your breakdown within the test itself, just your scores. Any one area you think you struggled in?
Large animal and pharmacology. I know exactly what they were because they were the exact questions that I went home and were like, these are the ones that bit me in the butt. It was these. I second guessed myself. I feel a lot more confident in my pharmacology already now. I think part of that is I was at VCA for 5.5 years before I switched to Creekside. And so I feel like I have access to better information and I work with the medications and the calculations and everything more often. That now when I have it in front of me, I can understand it a little bit better. Large animal, I am still currently working on. I have all the books and all the study materials of that, but because I focused, every time I tested, I can honestly tell you I focused too much on small animal and not enough on large animal. My brain was like, you're not gonna work with large animal, don't focus on that,
Well,
focus
that
on
was
this.
where your interest lies, so that's understandable.
Exactly, so that's where I focused, but I know now better that I need to do kind of like a more rounded form of study.
Was Dr. Villanueva in charge of the program when you went through?
Yes, Dr. B.
Yeah, I know because I taught at IBC in Fort Wayne.
Yeah.
So we shared an X-ray machine. But anyway, that's neither here nor there. But I know the large animal part of the program was a struggle for Dr. Villanueva.
Yeah, I only got to work with cows and horses for a very short period of time. And
so I
don't felt like it was very detailed.
I just know that they struggled with that.
Yeah, I never held that against them. I always held it more on me for not doing the proper studying.
I think we should approve Mary Beth's retake for the 4th time.
I would second that.
I see no reason why you won't pass it this time.
I hope to make you guys proud about that decision.
So, and be sure, as Laura said to Justin, don't be afraid to ask for those accommodations.
Absolutely.
Yeah, my therapist is already set, she's like, if I have to make you a letter, we'll get you a letter, we're gonna do whatever we need. I have a lot better support now, I feel, than I did the first 2 times I took it. And I think I have just as great, if not better, after with the 3rd time that I took it. So I feel very confident in this time.
Inhale through your nose, exhale slowly.
Sorry.
Don't change any answers.
Yeah,
One at a time, make your choice, move on.
sounds good to me.
All those in favor of Mary Beth retaking the VT&E for the 4th time, say aye.
Aye.
All those opposed? Nobody's opposed, so go get them.
Thank you so much for your time today.
You're welcome. Good luck.
Thank you.
Okay, we have another VT&E retake. Next on the list is Emily Dom. Sorry, Emily, for making you wait so long.
No, it's fine.
Normally, we have to get through our cases quicker, but Dr. Marsh had to leave early, so you got bumped a little bit.
That's okay.
So tell us a little bit about your experience with the examination, Emily.
So the first time I took it, I think I took it in 2019 after I graduated. I took it in Valpo and realized that there was a lot of noise during the testing. I didn't realize that there was multiple people taking different tests at different times, so the door was going open and close constantly. Because it's just not like you're taking the test, it's like other people are taking tests at different times.
So not everybody starts and stops at the same time.
No. And then the second time I took it, they didn't have any openings in my location, so I had to drive an hour and 15 minutes to a different location like Mokina, Illinois. And it was behind like an eye doctor place that just had computers, and it was the same thing. Multiple people, like I started at like say 11 o'clock and someone started at 11:30 or someone started at noon. And so the door's constantly going and like people are getting up and sitting down next to you. And then that was also during COVID, so you had to wear a mask and everything like that. And then the last time I just took it, I also had like the same incident. Like I started my test at 11 o'clock, well then someone started their test at 11:15. And so like the lady that watches you has to come in, set up the computer, and so it's just not you, it's like multiple desks, multiple computers, and so like hearing the door close and open constantly is like a distraction. Or like the kid next to me, his mouse wouldn't work, so you have to like hear his mouse rattle back and forth so you can get it to work. And so that was really stressful. But I also know like the last one I took was closer to my house, and so I know that one I took the whole time. And I remember I looked at the time thing because I knew I was getting close and I had 30 seconds left and I had two questions left. And so I know that score like improved from my last 2 scores.
Well, you did
392.
You did, yeah, you came real close this last time because Laura just pulled up your one exam was from 2020 was 200. So
Yeah.
First 2 were 200.
Yeah.
So 392 this last time. Only thing that looked a little low was the anesthesia for some reason.
Yeah, and so I actually took that sheet like they give you and I brought it to my work. And my friends are registered, and so I've been like the tech assistant in the back. And so they looked at that list of what I struggle with, and so I've been like following them around, and they've been like, while they're knocking out a patient, they'll like ask me questions about like what should I do now, or why is the blood pressure low, or anything like that. So they're helping me as well.
So when you're in DeMott,
Yeah.
so did you have to swim the Kankakee River to get to take your exam?
Through South.
Yeah.
Yeah. Wow.
You were actually one of my teachers at International Business College.
I remember.
That's the problem.
That's why she had no trouble with the large animal. I thought the large animal. So, yeah, I recognized you, but unfortunately, names are a struggle for me.
Yeah.
What, we've typically done in the past is emphasize what the other candidates has taken the prep class
Yeah,
again, if you
that's,
can.
yeah, that's
taking
what I
the
did,
practice
and,
test.
I emailed them, because I finished 100% of it, and when you finish 100%, they will open it back up again for you at no charge. And so they're opening it back up for me. And I've also looked into that crash course that Justin was talking about, with that Beth girl, it's 12 weeks. And she meets Zoom meetings every Sunday from 9 to 11. And then she gives you, she does a different subject each week, and then she gives you homework and assignments throughout the week.
That's
And
good.
then online, she'll like grade you and help you out.
What year did you finish?
I technically graduated in 2018, but then my externship was 2019.
Where did you graduate from?
International Business College in
IBC
Fort Wayne.
Oh, in Fort Wayne.
Where I
Yeah.
was teaching the large animal.
Okay.
So she passed the large animal flying colors. But,
Just say 100%
we had fun, didn't we?
Yeah.
We've never denied anybody. And
I'll motion.
I'm just surprised at the testing situation.
Yeah, that's why I have, like, I know the accommodation, I do have like a doctor's note about like, I had it at IBC where like, when it was time for finals or testing, like, I would have to go to a different area and the teacher would just sit in the room, but it was like quiet. I was just by myself.
Did you
This
request
is
that
AED,
accommodation for
PSP, right?
I didn't know I could until this time. I didn't like the last time.
Yeah, but VP
And then
VP.
someone
Yeah.
told me about something about how you had to have a letter, so I like got a letter.
Okay, yeah, you,
I
I can pass on that information.
Okay.
So when you set up for the next test,
Okay,
you can have that accommodation.
okay.
I can't imagine. I took the bar exam
It's,
and it was in a huge room, almost like a gymnasium,
mhm.
with these tiny little tables, half this size, and they were so old, there were just holes in the tables.
Yeah,
So you'd be writing as quickly as possible, and then your pencil would go through the table. And you're like, well, I don't think I can read that, and you just keep writing. People would be getting up and down. One person got up, screamed, and ran out, and you just kind of looked up like, oh, that's a shame. And you just keep writing because you had to get it out.
yeah, because I asked the girl the last time, I said, am I like, are we all taking like the VTNE? And she's like, no, like people are in here taking like, to get their realtor stated license, like sports management, and so it's, all of them are different times.
That's not fair.
No.
I was asking Paul, VTNE, isn't that monitored by ASVP, American Association of
Yeah.
Veterinarians?
AAVSB.
Yeah.
is who runs it.
And I bought like the, they have like the 2 tests, like you can buy for like $45. I bought those.
Now,
And
what I'm
study
getting
those.
at is, with those terrible conditions, taking a test, somehow we ought to be able to complain to somebody.
Yeah, I can talk to.
Because that is terrible.
Were they the same place, did you say?
I complained the first time to the first place. Like I emailed the place, but they said that there's like nothing they can do about it, like they're a testing
I
center.
remember the
Yeah,
locations.
they're getting paid to do it too.
It was in Valparaiso, Indiana. It was the Ivy Tech School.
Right.
I just know the other one was in Mokena, Illinois was the second one.
Mokena?
Yeah, MOKENA.
At least one.
Mamma mia.
Well,
Glad I wasn't plugged in.
I can,
And the last one was in Maryville, Indiana.
okay. I can let them,
Yeah, there's been some complaints.
It's all right. Don't worry about it.
oh, I thought the white screen fell. I was
No,
like, that's not
no.
good.
We don't
just
care.
No, just
lost
there.
the power.
I don't even know. I guess I hit this cord down here.
So all those in favor of Emily Dom retaking the VTNE for the 4th time, say aye.
I
Anybody opposed?
What was the motion?
don't know.
I motion.
I said,
Natalie and Steve. Ms. Goodwin and Dr. Sunbury.
Okay.
5-0.
Right.
Sorry, I did not recognize you.
You're fine. When we first got here, I pulled up a picture because we took like a class photo and I was like, that's him, isn't it?
Really?
Was I nice to you?
Yes.
What should you say now?
You could say, no, it was horrible.
Did you get to see Buffalo?
Mm-mm.
No,
That was later.
that was only a few times where you arranged that.
We've been debating the bison versus buffalo in our house recently.
We did.
So you guys got
2 horse
snow up
visits,
there, right?
Goats.
We did, yeah.
It's all milk.
It's all
And you
milk.
got out of there, though.
Yeah.
Emily, were you living in Fort Wayne?
Yes. I was living like in the dorms at the, like the college
Yeah,
place.
down the street.
Yep.
At the apartment
Mhm.
that caught fire,
Oh,
way before yours.
Was that you, Bill?
Oh, was it?
No, I mean.
Oh, yeah,
I'm
those,
seriously,
the
there's
girls.
three students died.
Yeah.
Oh my
It
goodness.
was horrible.
Oh my
It was
God.
right after I first started teaching. All right, I digress. It's good to see you.
Best of
again.
luck.
Thank you very
Such
much.
a happy board meeting.
No.
Thank you, Emily.
Yep, thank you.
Safe trip home, guys.
Thank you.
Okay, we're moving on to an application. It was a long time ago, but it was horrible. It devastated the whole school. So do we have one more VT&E retake, correct, Madeline?
Yeah. Not getting any happier.
So Madeline, Granger,
Granger, Indiana.
Granger, Indiana.
Oh, you.
Where'd you go to school?
Penn Foster.
Penn Foster.
You live in Granger?
Yeah.
All
Oh, I'm
online.
very familiar with Granger.
Yeah. Nice.
And Madeline, what is going on with pharmacology? It's killing you. It's killing everybody.
Yeah. I think the 3 times that I took it, some of the questions I recall were large animal and pharmacy. So I'm not in any practice that does large animal. So I feel like that's where I was holed up, it was asking about, what do you use in a horse, or what do you use in a cow, or, those types of questions. And I worked with dogs and cats.
You were so close this last time.
Yeah.
386.
Mhm. At least I know my score could change.
But the,
Yeah, really.
62 twice.
Twice.
I was gonna say, if I got a 3rd time, I'm like, okay, something.
but the pharmacology and the laboratory stuff was consistently the lowest
Okay.
of your breakdowns. When I looked at it, you were like, first time, I think was 22% in pharmacology. And you doubled it, you got up to 44, but, the pharmacology and the laboratory stuff were the lowest scores.
Yeah, I work in, I think I was relying on my experience a little too much these past few times. I guess you could consider me a veterinary assistant for the past 7 years, going on 8 years in May at my clinic. And we're AHA, so we're very particular in what we do and how we do things. So it's like, okay, we're pretty much almost to the textbook answer, but I was relying on Noah's answer too much, I think, these past few times.
That's who you work for?
Yes, Noah's Landing.
And then my sense is that where most students struggle is on the calculations portion of the pharmacology. And, when you're in daily practice, we're all relieved that we don't have to do a whole lot of that. You have to know the names of the drugs and that they're NSAIDs or antibiotics and some dosage information and milligrams per kilogram's easy. But when you got to make a 5% solution out of a 10% solution mixed with a 3% solution, that's where I usually turn to somebody else and say,
I had no problem with that.
oh, come on.
I called my wife, she was
Yeah.
a
There
pharmacist
you go.
doing
But I know
IV
that's
additives.
That's
I
on
said,
the
okay.
exam, am I correct?
Tell her to do this.
Yes.
Aren't there at least 4 or 5 like that?
Yeah, and when I took it last, there was a lot of that, and there was a lot of asking, what do you give the horse when it's doing this, or what do you give the cow when it's doing that? I felt like there was a lot of, I felt like I kept getting a lot of large animal questions in regards to pharmacy and in general.
So it sounds like you know what topics you need to focus on.
Yeah.
And that you do have a lot of room for improvement in those areas. Think about how close you can get to 425 when you just work on.
Yeah, I'm this close to going to a large animal clinic in my area and say, can I just shadow you guys for a few months?
Well, and that might be helpful, but I think the study materials might be a better fit to spend more time on because like we said, in private practice, sometimes all of those calculations is, sometimes, we really don't do those very often. So you might find that just like with your work experience now, it hasn't really set you up for a passing score. Shadowing a practical large animal lifestyle might not either. I think the study materials you should probably focus on the most.
I would second or third that. I think we've all at one point said, we're glad we passed our tests and don't have to retake because I'm very comfortable with working day to day and what I'm doing. I wouldn't want to retake the test right now. And if I had to, I would be doing the study things. It's not my everyday stuff. So the prep, the TD prep and all, what you've heard the others talk about, I would suggest those, it's the bookwork part, probably more so than the hands-on that is going to help you with those scores, I would say.
There's a book, I believe, by Dr. Pete Bill, who was head of Purdue's veterinary technology program for over 20 years. And there's a pharmacology book written by him, and I think it's geared towards veterinary technicians. It's worth Googling, looking into. I keep forgetting to search it and write it down and recommend it. But he was the director of Purdue's veterinary technology program for a long time and taught pharmacology to vet students and to vet tech students. I suspect that might be a good reference to look through. And I don't think it's probably that expensive. It's worth investigating.
Yeah.
But we're certainly not here to punish you for a 386 this last night. That was excellent. You should be complimented for your improvement and not just keep going. I'd make a motion that we allow a retake for the 4th time for the VT&E.
I'll
For
second.
Madeline,
I'll second.
Minty, and Schnarr. All those in favor?
Aye.
All those opposed? 5-0.
Thank you so much, guys,
Good
for your
luck.
time. Thank
Good
you.
luck.
Okay. Now, where are we at?
I want to skip CE audit to the end
Right,
and just do my report with that. So why don't we do the AG's report?
okay.
One application got continued. Is that correct?
Yeah, we have 2 cases continued. One is Dr. Johnson, and the other is an unlicensed practice.
What about the application that Kendall?
She was a no-show.
Okay.
I love that.
We had a,
Get in trouble with us.
Then
Don't
we
show up.
have- yeah, we did have an application, you're right. I missed that.
She was a no-show.
That was the doctor for trying to practice in Delphus, Ohio. This is like the 2nd time. She's been on our docket at least one other time.
Yeah, I remember.
Because I've got notes on her in this notebook.
Why in the hell should we work on trying to keep our practice or our licenses? If you get called here, you just don't show up, the hell, it'll take you 3 years.
Well, she had an issue with the Ohio board that was resolved over 2 years. So,
What?
he said, he looked at me when he said it'll take 3 years. I said, it's not my fault.
Oh, there she is.
It was foggy out.
Well, I
Do you
mean,
officially call her name?
So
Charlotte Dingle.
these are for you. These are all advertisements for chiropractic,
Really,
equine dentistry.
Did you see?
really you need to give them to Laura and she
Yeah,
files a
yeah,
consumer complaint and just
yeah.
attaches all those.
Is this the same guy we?
How do I
did,
file
He's
a
one of the
complaint
ones.
though? Do I have to
Okay.
file a separate consumer complaint
Oh,
for
God.
like every
each of them?
single one of these? Because
Where do you get
really,
those?
I think he just goes
What
up there
publication does
and
this?
tears these out because he thinks I have nothing.
Still getting in print.
Because
So we
really, the
have-
last one
You
you
said
sent
this
me,
was,
I thought there was one person, there was like 20 people on there. And so I was like, well, I'm not putting off any more consumer complaint forms. So I just listed 20 people.
There's a dozen,
Unlicensed people on
there's a
there.
dozen. The problem is, my wife likes to go to Yoder's Meat Market in
I
Napanee.
do too.
So we go to Yoder's,
too.
she grabs one of these magazines, okay? But the thing is, you gotta look at this, it's not just dentistry. Chiropractic, electromagnetic therapy, salt therapy. Some guy's grinding up salt, putting it in a bag and putting it over the head for these horses to inhale. It's supposed to help heaving horses, and it's some kind of magic salt. Now, to me, that's got potential.
I don't think we have jurisdiction on that.
Or bath salts for horses?
Is it Himalayan?
Magic
now?
we don't do.
And
It's craft.
but there's,
It's not ours.
there's chiropractic and
these are all.
and a half a dozen, no, not all, they're not all Amish. And a half a dozen,
Hey,
Typical
Stephen
equine-
Yoder is doing it.
equine dentistry.
I'm sure there's only one Yoder up there.
Right, you can find.
So the problem is, my wife feels like my blood pressure's getting a little low on the drive home, so she starts reading these. So then I pass them on to you, because Hirschberger is because I sent you that a year ago.
Oh, you sent it to us, okay.
Yeah,
Do you try
He's
the
the one.
license at Yoder's?
I swear we had one similar. to-
but it's Amish community mostly, but they're not all Amish doing this. But this is, we go to Napanee, and this is where this, free magazine for advertising. But it's rampant in that part of the state, obviously. And we got a past president of the IVMA, help me with their name, that practices in LaGrange.
Christine, yeah.
Why this is not giving her a chest pain than it
Yeah.
is me for an hour and a half away. But,
There's someone, she's a RBT, I cannot think of her name right now, but she files a lot
Okay.
of that stuff.
Hillary Christner, sorry.
but yeah, I mean,
What did you say, Ray?
you guys.
So there's an RBT who's
Years
like
ago.
part of the Indiana
Body work,
Yeah.
Veterinary Association.
the salt therapy.
And she will find stuff online or find advertisements like that and file them with us as well for unlicensed practice. And it's stuff like the salt
There's like three of- The salt
that's-
therapy.
or the Cairo stuff that's just,
The salt
wild,
therapy
you know.
kind of bothered me. Yeah, big advertisement, salt therapy. But you guys can glance at them.
like that one, Laura, if it's just the one person doing the salt, like that would be a good one to definitely send to us.
Because the salt therapy, in my opinion, has a potential to cause harm. I mean, so is floating teeth done
Is it putting a
improperly,
plastic bag over the head?
Yeah, that seems a little.
harmful?
but,
Suffocating?
certified equine dental technician, complete balancing, 90 hours of school. Well, we don't care. There is no school. I have to clarify this all the time. Gavin emailed me, said, well,
Yeah, we
can they still float and just do caps? No.
What's floating?
That's the way.
We left it.
Dental cleaning. Actually, if they would if the Senate would pass that bill that was out or 2022, it would be great because there's actually a definition of teeth floating, equine teeth
Well, the
floating.
problem we have in the legislature, and this goes back 2 or 3 years, is there's a bunch of legislators that, they have horses and they want to get it taken care of. They don't want to pay the vets.
Well, I get the problem with this particular set of advertisements, like I said, the other stuff, like the electromagnetic therapy guy, he's doing humans too, horses and humans. And the salt therapy kind of, when I read that, that kind of bothered me. But chiropractic, I mean, these guys basically think they're okay. This guy that did a training course somewhere doesn't realize it doesn't have any bearing in Indiana. We have equine practitioners that insist that we prevent any lay equine dental bills. The IVMA is obligated on behalf of those equine practitioners to oppose that. The problem I have is I get asked all the time, we can't get a vet out here to float teeth. And the vet that did it did a horrible job. And so-and-so's been doing this for 25 years and he's great. And I always have to say, don't tell me his name. One of my best friends, he has a lay dentist and I tell her, I don't want to know. Don't say his name, don't tell me. Because I'll have to obligated to report it. I mean, I know veterinarians that paid lay people to do their horses' teeth. A colleague of mine raced horses and had a lay dentist do his horses and paid him.
And in other states, there's a separate like certification or licensure for it, and there are courses that they can go through. And so if they're working near state lines, they don't realize that they're not allowed to do it.
They do.
I mean,
They realize.
some do and do it anyway, and I think some I think don't actually know.
Well, it's like I said, we get in Indiana with the legislature, we had too many equine legislatures. People, what I'm trying to say, they don't want to change. But we've gone through this repeatedly, I think.
Well, the bill's come up about 3 times, and we opposed it and got it dismissed all 3 times. Sooner or later,
It's becoming more difficult because of what you said, because there's fewer and fewer equine vets.
and I don't have an expert down there because I didn't do anything. But one of the big equine practices in my area, they're opposed to this, but they can't even come close to meeting with it. They got surgeries to do, medical cases to deal with. Anyway, go ahead with your report. Sorry. You got off the hook. I gave all those to Laura.
Well, first I want to tell you about my experience taking the bar exam, since Laura got to share hers.
It was awful.
Okay, so the bar exam's 2-3 days, depending on, was it 2 days or 3 days? It's so
Mine was
dramatic, I
2,
don't
but don't
remember.
even tell me yours was on a computer because I have no sympathy.
Okay, well, it was on a computer,
Oh, there you go.
but it was at the convention center. And outside on Washington Street, they were doing road work, so there was a jackhammer going the entire time, and like a table this size, it was going like this the entire time we were taking the exam. And
But go
then,
ahead, pass the bar exam. It's the only most important test of your whole life. But okay.
and then, in one of the other rooms, there was some sort of like death metal convention or something, I don't know, it was really loud. And then my favorite part was the last day, and at White River State Park, John Fogerty was having a concert that night, and we got to listen to his sound check. So put me in
Yeah, but
coach like during.
that makes you a better lawyer, because if you can handle all those distractions, nothing in a courtroom will,
I really like John Fogerty.
Real quick, Clarence,
I
let's
do
hear your
too.
story.
Recollection about
Hey, I have free copies of the bar exam.
I can understand that. You just completely erase the worst part of your life in those 2 days, and you have no recollection of, like, I hardly remember law school, and I avoided all the classes that I didn't want to take, like commercial law, trusts and estates, taxes. I didn't take that, and anything I needed to know, I learned in Barbary. In fact, I didn't even understand what a contract was for most of my law school career, because Professor Mitchell would just say, I don't know what a contract is. Is there a consideration? We don't know. Do we ever know?
And so I got to Barbary and they just laid out, this is a contract, you need A, B, C. And I'm like, seriously? I spent a whole year and I learned it in like 2 minutes. I saved so much time by just studying Barbary.
You remember getting on the bus to get lunch, like during break or something, and one of my classmates was on the bus looking real depressed.
I mean, that was
And I remember
4
sitting by
hours.
him and he wasn't like saying anything, and he didn't fail that exam, he eventually passed it, but I do remember that.
You felt better than he looked.
Are we on,
Yeah, we're on.
are we on the record?
No.
So I've like totally lost control of this. Okay, give us your OAG report.
Thank you. So this is only the second time that I've done the report. I'm sad that Dr. Marsh isn't here because Amy Osborne, my section chief, did go through and change the numbers to reflect that they're by month instead of just being standalone numbers. Do you want me to read through the whole report, or would it be easier if you have questions that I can answer, or I don't want to sit here and read the whole thing to you if you don't need me to, but I'm happy to do so.
Hit the high points.
Okay. So on the first page here, we have the consumer complaint report. As of November 2023, we have 5.5 cases. And in January, we have 6.9, so they've gone up this month. We have 2024 open and closed files. We've had 56, I'm sorry, the one's not in color, so.
Do you want to use my computer?
That's all right. The sum of open at the beginning of the current year is 56. Currently open is 51, so we've closed a couple since then. And the sum of the closed during the current year is 3. Quarterly open closed for the quarter, we have 4 open and 4 closed. Consumer complaints by county, it looks like Allen County, Marion County are still the highest, with Hamilton County and Lake County coming in right behind them. For consumer complaints by county of complainant, oh, I'm sorry, that first one was county of respondent. So county of complainant, it looks like Marion County is the highest, followed by Allen County and out-of-state complainants.
So how many open total do we have right now? That's the part I always have trouble finding.
Open investigations.
Yeah.
51, it looks like.
51?
Mhm.
So all those in favor of revoting someone else to be board liaison?
Denied.
Denied.
51 more coming?
We don't ask you,
I know you only
Questions on
asked me
everyone.
you only asked me the tip of the iceberg. I get
how
it.
many come?
81.
No,
Hey, medical board has like hundreds.
to me, the two
Yeah.
most, the two most important numbers are how many total are open and how far behind are we, you know?
What do you mean by behind? And behind in
Like
what sense?
The average age
Okay,
of what's open.
of investigations?
Yeah.
6 to 9 months, I think what they use.
6.9.
Oh, did you find that?
That's number, that's the first page.
Very large number.
The great, big giant.
That's that 6 number. Okay.
6.9 consumer complaints.
No, but
No,
I'm
that's the
I'm
average,
looking for how many months there have been open.
Oh.
It says average age of open
average
files by
age of
month.
open file by month. So in in November of 2023, it was 5.5 months, and currently it is 6.9 months.
Okay. Open files, all right, I got it.
But those are consumer complaints, not litigation.
That's not ones that are under investigation right now.
The consumer complaint average age of open files by month is investigation.
Okay, so they're under investigation, those cases. That's what I'm trying to.
Yeah, so there's 51 currently open, and the average age of those cases,
That you're investigating is 6 months.
6 months.
Okay.
Is there a stat on how many you take action on?
Because I review cases sometimes
Cases
that are
closed. so
still
this year-
2022.
Oh,
this year, that's no violation.
A few of
That's
them,
just
2022 or 2023. Let me ask you a general question. When a consumer files a complaint and you determine there's no violation, no litigation, are they notified of your decision?
The consumer,
Yes.
yes, they receive a letter that
Okay.
I think the letter now states something to the effect of, we have declined to continue further
Okay.
prosecution or.
And there was
declined to
no-
prosecute or something.
And,
No, we don't say that there was no violation, I
okay.
don't think. I think
You
because
just-
we're attorneys, we say something more of, like, we have declined to prosecute this case. Or if we issue a warning letter,
You are always free to consult a private attorney at your own expense.
see, Laura wrote the original letter.
I did. I did.
But what I'm saying is the consumers are notified when you've made a decision not to pursue a case further.
Yeah, the consumer is notified if we pursue litigation, if we don't pursue litigation, and if we do issue a warning letter.
When I filed a complaint against you.
I won't go into any details, but I get contacted a lot about things. And I really don't know the details. I'm not supposed to. So,
We do not, because our investigations are confidential, everything we do is confidential until we report to the board by filing the consumer complaint that there is merit to the case, which is why you're now receiving the consumer complaint attached to the administrative complaint.
Totally unrelated.
so when
Our 5-day case. that
when
went
you
up
and I
there.
or
Wasn't she in
whoever
danger?
make a decision
And weren't they in AHA?
not to pursue a case further,
I was like.
that
"Oh,
is
do they
still
have
got to be
care?"
confidential.
She was saying I was
Because
bringing
there's
up.
no
But-
hearing,
The
I just
facts,
embrace her now.
yeah,
there's
facts are all
Have you been here
confidential.
before?
but people can look up and see if consumer complaints, how many have been filed against an individual or not. So that data is not available either. Well, you have it, but I mean, it's not available to the general public. So someone can't look up and say, oh, Dr. So-and-so that I filed a complaint on has had a half a dozen complaints over the last 10 years. They don't have access to that.
Correct.
I mean, and the reason for that, besides statute, is that people can file frivolous complaints. I remember
Right.
all the frivolous complaints we went through.
Right.
You know, and it's not fair to the licensee.
And you don't necessarily tell them why you're not pursuing it.
No, because they're lawyers.
Correct.
Right.
That's why we say.
But you guys wouldn't believe the number of texts and phone calls I get from here and there. So I hear you're on the board and I tell them, stop. Don't say another word, stop.
Now, there may be times where a complainant will call us, call the investigator and say, what's up? This has been however long. And they'll say,
Yes.
I've finished my part of the investigation. It's been moved on to either the deputy, like me, who's reviewing it, and then I make a decision as to whether I'm gonna charge or not charge. Or I'll do further investigation, or maybe call you, do different, it might take me 10 minutes to figure it out once it comes on my desk, or it might take me 3 weeks, depending on the circumstances. Once I do whatever I need to do on it, then it goes to my supervisor to approve it and or reject my recommendation. And from there, I mean, that could take, it's not supposed to take that long, but life happens and sometimes she just can't get to everything within like a week. So we will have people call and we are kind of in a limbo stage where we know that we're closing it but we can't tell them that until my boss has officially approved or
But when it's
rejected.
closed, they do get notified. Yeah, I just have to talk in general terms.
Luckily in my circle, nobody knows that I'm on this board or what it is anyway, so.
I know you're on the board.
No one has, I never hear about
And they
it.
start to say something and I say, stop. I said, now, if you want to ask me a general question, like what happens when I get an OWI, you better report it on your next meeting. That's all I tell them.
And I'll say that anything that has to do with actual veterinary medicine goes through Dr. Clemente before we do anything with it, or Dr. Rodenberger if you recuse yourself. Because I'm not a vet, I don't even own a pet, I don't know animal anatomy, I can't.
Yeah, but you learned a lot.
Oh, I have learned a lot. I still, when it becomes, I mean, there's a couple of things now that I know, because I've seen your response to it enough that I feel comfortable with either moving forward with it or closing it, because I know that it is either definitely a violation or definitely not something that's gonna be a violation. But we're still sending the liaison most of our cases. Now, if it's an OVWI or a conviction for something else, that doesn't need to go to Dr. Clemente. But if it's about veterinary medicine, it goes. And there are things that are technical violations that maybe the board doesn't, would do a warning letter unless there's a significant amount of, incompetence or a repeated pattern of incompetence with this particular provider. It's the same thing with the medical board, so. And Dr. Clemente does not delay. He's up at 2 o'clock in the morning responding to our emails.
Dang, Paul.
I don't sleep at all.
I don't
It's
either.
not my choice.
I sometimes email Gary at like 5 a.m.
At least I'm not texting her.
He's never said anything though, like, why are you looking for me?
She hasn't given me her phone number yet.
He's not opening them until he's up, right?
All right, what do we have next, Laura?
We have CE to discuss.
You told me we had no CE 2 days ago. Oh, you're talking about veterinarian audits, not CE approval. Let's move on.
Do you want to look at my report first, because then I need to step away from my computer to go over the CE stuff.
And then the board director or
Board director report.
This is a CE audit report, correct?
Well, we'll do that next. Right now, I'm just gonna go over my board director report really quick. I changed things up a little bit. I hope you like it. If you don't, you can say, I don't like this, guys, and ask me to change it. First of all, I see Dr. Sunbury criticizing my spacing issues.
I'm so dang OCD, I'm sorry.
I'm sorry, but it was Adobe, and I was editing an Adobe document, and that's what it would let me do. So I knew I would get something from someone, and
It's me.
yeah. So anyways, the bold is what the current number is, meaning the numbers from November 3rd, the day after our board meeting, until yesterday. The number to the right of that is the number from the last report. I thought you'd like to see a comparison of how things are going up or going down. Clearly, we're receiving an influx in vet applications. Issuances are on the rise as well. Renewals, obviously, that's from the last renewal cycle. And so the current active veterinary licenses is up from November. We're at 2683, we were at 2599. CSRs, as I'm sure you all well know, I don't have control over, but the vets can have a CSR, and I just thought you'd like to see those numbers. They're holding pretty steady. CSRs can only be, the only thing I'd point out is the renewal column. It's 24 now, it was 1,601. Again, that's due to the renewals of the vet licenses. They can't renew their CSR until they have their vet license renewed. The primary license has to be renewed first. RVTs, Their renewal window just ended on January 1st, and we're still getting some of those rolling in. We're getting also quite a few new applications. So as you can see, the applications are up from 30 to 55. Issued are up about holding steady, but still 38. I've issued 38. And you can see the renewals have gone through. Total active is 1,989. It was 2,185. I had quite a few that want to go inactive. We have quite a few. I think we were at 75% the last time I checked, 80% on those renewed. So some people, and I think it's more prevalent with RVTs, they just move to another state and let their license lapse. So it's not as common with veterinarians, I don't think, because they like to keep the license active, especially if they're going to work at another state. They can apply by reciprocity, and I just don't think RVTs do that as much. So
Also think from talking to RVTs, talking about their colleagues, and they'll say, you know, they've decided to go in a different career direction.
Right.
Right. I don't know what the average
What does it cost to get
career
an
year is now.
RVT
It's
license?
down.
not very much.
That's what I'm getting at.
Yeah,
Once
30
you
to
got-
get one and 15 to renew.
Once you got the thing, why not keep it? I am still licensed and active in Arkansas. I have no idea when or ever. No, I do. I'll never go back to Arkansas. But, you know, that's what I'm saying. If you're approved, you know, why not keep it?
Do you still have the car mats from your car in 1968?
No, I got weather checks.
Okay, just checking.
And they're all full of salty.
We will have a probation withdrawal next month on the board's calendar. We will also have possibly a probationary appearance or another probationary withdrawal. I'm not quite sure where that stands, but I know for sure one of them is withdrawing or is going to petition to withdraw. Complaints filed. I'm getting ready to file a complaint that was sent by our general counsel to me, to the Attorney General's office. And I continue to file newspaper articles that's sent by a good friend of ours while he's shopping at Yoder's Meat Market to the Attorney General's office as well. So those keep rolling in. And
Hey, turn around and stare. They're gonna send me these cases, I'm gonna send them.
So do I have any say in any of this? Or?
You're under, this meeting right now is under your jurisdiction. Continue.
Oh, okay. So anyways, that's my report. Are there any questions? Because I really think what we need to focus on and I need answers on is the CE audit.
I'm always really concerned. I'm playing devil's advocate, but every year I'm always concerned around summertime, how many Purdue graduates apply for animal licenses. That's the number one thing that's always on the top of my list is come, May or June, how many applications we're getting from the graduating class.
How many are hopefully staying in Indiana?
Because you've all got the emails now about Hanover College is going to start a veterinary school.
Well, I can tell you that I am making more of a physical presence at Purdue with Dr. Marsh and separately from Dr. Marsh. So I'm going with AABSB up there, and we're going to have a presence up there. I'm going to speak about the veterinary board and Indiana's veterinary board and provide them information. I was actually invited to speak. Dr. Marsh may go. It depends on calendar conflicts. We are also, we go to all the conferences. The Purdue conference, we tend to focus more on those that are graduating, but the IVMA conference, I'm going to start providing information to licensees to help them have quicker access to what they need on the board website. So I get a lot of questions about how do I change my address? How do I change my CSR address? How do I order a verification? It's all so simple, and I turn around verifications in one day for licensees. So all they do, but they don't know where to go. It's a new website. They're a little bit confused. Some of them still think they should go to PLA. And so we're gonna have that out, and we're gonna make a presentation to them as well. And we're gonna have just little flyers out that they can, cheat sheets they can use. We're gonna add more information to the board website, all in an effort to make Indiana as friendly as possible, to attract more people to Indiana, because, hey, you know, take your vet license to Indiana. They're user-friendly, their board is responsive, they want to help. So that's Dr. Marsh's mission and goal. That's my mission and goal. That's why we've signed up for a lot of this the Viva database program, so we know who's disciplined in other states. I think we're one of the first 10 states to have that. So, and also, while I'm speaking of it, we need to be thinking about, and you guys can send me just one of the 4 months this year, the head of AABSB wants to come and meet the board and speak to you all. He has never met the Indiana board. He's spoken and contacted me several times. And then now the outreach director's reaching out to me. So I thought about October. But
Ms. Lang, you're in charge of the menu.
Yes.
well,
Agenda.
I'm also trying to think about getting away from the
Well,
travel in the
RBT.
world.
October is always a good meeting because you don't have to worry about weather issues, cancellations.
Right,
So
right.
That
So,
would be a good time.
yeah, he's been asking me if he could come. We're on his list this year.
As long as Dr. Schnarr.
You're that writer makes me tired.
So tell us about
Okay.
your auditing situation.
Pretty
All right.
much,
Without them self-reporting.
And I think that's why Gary's here too, so,
pretty much.
because I think he wants an answer.
Indiana has always.
So I'm just gonna-
Background check and others, but this is-
I tend to think better when I stand,
Yes.
so I'm just gonna stand over here and do this.
Okay.
That's what this is.
Well, I will say, this report you just gave us, I don't remember we ever got anything like that before. You're doing good. I mean, we're getting more information, I think, so that's good.
Well, my boss is in the room, so anything else positive you wanna say, like, I mean, you're a miracle director. You know, anything positive, great, outstanding, fabulous,
I'm not gonna-
like a gift from God, you know, anything like that. That's good.
I do give you an immense amount of credit for the promptness of your responses when we, you would contact you about issues. You're very good about getting back with us quickly.
Thank you.
Which
Well,
is,
you are the board,
which
so.
is, yeah, but it's something that was deteriorating gradually.
She's like, that's my
We're
job.
getting much faster responses on everything now.
I thought that was the
Absolutely.
job, but
More
if you want to thank me
confidence.
for it,
More
okay.
confidence in what's happening
Yeah.
and faster.
The
responses.
ITLA was
Thanks.
so overwhelmed.
Yeah.
And I think they
no
still are,
fault to the
unfortunately.
previous-
We've yet to
Zero
have
complaints.
I do
to
feel for them.
3 months worth
Who
of
accepts the
minutes.
address to
Yeah,
not rent.
you did.
Yeah.
Your speed and rate of return is excellent.
Well, thank you. Okay, I know he heard that, so we'll just move on. Continuing education statutes and rules. It's in your green folder. You might need to look at it. You might not. You know what? I need my statutes and rules as well, so. Never come to a board meeting without statutes and rules. Learned that a long time ago. So, here's the situation. I've got about 70% of the audit done now. So, most of the ones, no, I shouldn't say most, all the ones that I've completed and sent completion letters out to that they have passed, did live CE, there wasn't a problem. A lot of them went to VMX, which I didn't know was a conference, but wow, you go there 2 years in a row and you're set. Some of them went to Purdue, some of them went to IVMA's conference and got all their hours. What we're running into are issues of, well, a lot of things.
Some of them don't have all their hours. Now, if it's by a lot, then I'm gonna fail them. But if it's by 0.5 of an hour, I guess that's issue number one. I'll go through the issues and then we can kind of discuss them one by one. If we want to just have a hard and steadfast rule, you didn't get them all in, even if you thought you did, then it's a fail on the audit. One individual was sick, very sick. He wrote a long letter about how he had long COVID, and I have that information with me. One individual went to a conference 2 years in a row, and it resulted in 25 hours each year, but the conference has yet to send anybody the certificate for the second year. And he's calling me every day frantic because he says, I went to the conference, but I can't get them to send me the certificate. What do I do? And I'm like, I don't know. Other issues include things like they might have done 5 hours live and the rest of it distance ed, which we'll get into that in a minute. So less live than you normally are, I think, used to seeing. Some of them did all distance ed. Some of them did, most of them, I would say 99.9% of them did either race approved or associations that you have all previously approved. One of them, though, I'm not even sure of, IndyVet. They're not race approved, and they're called IndyVet Emergency and Specialty Hospital at Victory Drive in Indianapolis. A DVM signs it. I don't know if it was live. It says they attended it,
They do them weekly or monthly. We get emails about it all the time.
Yeah.
Are they live or are they,
I think they've been both. I think if you're close enough, I think they have a room that you come to. But I think, did you ever read those when we get them the emails?
Yeah.
I think some of them you can get on.
like it's a
So
live,
it's live.
like interactive webinar? Okay, we'll talk
Haven't done,
about
but that's
that
my
in a
understanding.
minute. Okay, so I think those are enough of the examples that we need to dive into what the issues are. This board requires 40 hours of CE. That is on the first page of your statute, or statute packet that I gave you. After that, if you turn on page 2, you have the statute on distance education learning methods. And it says that a board or agency under this title or under IC 16 or IC 22 shall require that at least half of all continuing ed be allowed by distance learning methods. Now, I think what's happened over the years, and this is the best that Gary and I can come to, because the statutes and rules of this board do not marry up, is that PLA took that, and the board made some type of policy at one point that it says at least half. So you all said, okay, 20 hours can be distance ed. 20 hours. There is no rule in the vet board rules that 20 hours has to be, or they have a limit on 20 hours distance ed. In fact, the vet board rules talk about self-study, which is something totally different. Self-study is a very, very, very old way of perhaps reading an article or looking at an online journal and then taking a quiz. You have to have some type of, and I wrote it down, post-evaluation. Bear in mind that many of the rules were written in the 80s, way before COVID happened, and you all did not do an audit during the COVID years, 2019 to 2021. This is your first audit after COVID, and things have drastically changed. Things like now we have interactive webinars, virtual conferences, places where you don't have to go to VMX. You can just dial in online, go to the conferences you want to go to, ask the speaker questions in the side panel, and you've attended the conference. Self-study still is something they can do, but post-evaluation is gonna have to be provided by somebody. I did have someone submit to me 20 articles, and they just put a Post-it note on the top that said, I read these.
Back in the day, that was, conversation with another veterinarian was, I wasn't on the board, but just, I was told that that's what was used. You could read, you could say, put down, oh, I read this journal, and that was considered
Self-study.
self-study is what I was
Okay.
told.
Okay. So we have all of this going on where people are doing self-study in the traditional sense, read a journal, you do a post-evaluation. It's not happening so much, but we have a lot of distance ed going on. Some people do, now that they have interactive distance ed, think of your conferences where you can engage with the speaker, and I would call webinars, where it's taped, you know, saved, and then they watch it later. And so that's really how I've been dividing things up. You know, 20 hours live, 20 hours distance ed. That's the best way in my mind to reconcile everything, because there was only one person out of the whole 233 so far that have even looked at journals. One person. I just evaluated them the other day. So I only have, I would say about 20 maybe that I'm just unsure about. And I'm unsure because of these issues. Recorded broadcast of web conference. I see that as more of a distance education issue. But then again, I'll show you. Recorded broadcast of a web conference. So to me, that's saying I didn't attend it live. And race also, in the race approval, it also delineates out what that means. It means that it wasn't interactive, that they viewed it at a later time. Now, you can always email the speaker with questions, but it's not like an interactive virtual conference. But then we have to go back to the distance education statute, where it says at least half of CE is allowed through distance ed. At least half. You do that because you allow 20. But can you offer more? Certainly, because there's no rule in the vet board rules that says that you're limited to 20. You've always operated under that policy that maybe even PLA came up with, and you've all agreed to at some point, but there's no rule. There's no solid rule on it. And to go even further, this is the very thing that needs to be addressed when we attack the rules this year. It needs to be brought up to speed to encompass the world we live in terms of CE and how we get it. Attorneys like us, I got almost all my CE last year by watching webinars. And then I have to click so often that I'm there, and then they send the certificate to the bar. Now, Gary, I think, attended most of his, correct? But he knew that I didn't go to the Inspector General conference, which was 3 ethics hours, which is required for me. So I watched it on Lawline, which is an approved vendor for Indiana, and I got my 3 CLE. And I was all web broadcast. So my question to you, in finishing up these CEs, and then going on to RVTs, my question to you, more my recommendation, and we can discuss, because I want Clarence involved on this. Because the statute says at least half is done through distance ed is not defined. The rules define self-study, and no one seems to be kind of doing that, or maybe they are, that if they do 40 hours, we're going to approve it this year. We're going to get these issues cleaned up when we rewrite the rules.
Well, I was surprised when you were saying that half of it, I was practicing right here in Indianapolis when the CE requirements were first passed. And I think it wasn't half, it was a lot less than that, like 10 hours. Maybe
It's 10
max.
hours self-study,
Yeah,
but it's
Okay.
20 hours distance ed. See, they're two separate things.
I agree with everything you said, that the biggest.
very
you know,
confusing.
The world has changed since the 80s. I mean, we even have computers now. You know, I mean,
Right.
webinar type thing, it needs to be changed. And I kind of agree with you. If, at this point in time, if they say, if they've got 40 hours of some type of CE,
I find it hard to say no to that until it's cleaned up. So what
Yeah,
you're saying, I would agree.
My worry is, we're gonna say someone failed, and then they bring an attorney before the board. Can we, like, hold a solid legal position that, no, you actually failed the CE requirements? Here they are, 40 hours, and you can only do 20. And I don't feel like 20 distance ed. I don't feel like we have solid footing on that because, number one, nowhere in the statute is distance ed defined. Now, self-study is defined, but the board limits that to 10 hours. So, and nobody does self-study. So it gets very confusing when you're involving fines and things that people have to do if they're low on their CE. Then you're going to have attorneys walking in here and making some pretty strong arguments, and I don't want this board to be put in a bad position.
Until it's cleaned up, I don't think you can.
Do you want to add anything, Gary?
They want to do all 40 online, they can. What's that?
Under the rules.
Yeah, so it currently
If they wanna do
reads
all
like-
40 online, they can.
That they could.
According to the rules.
They can't do 40 online?
The way it's
Yeah.
currently written,
Yeah.
they could.
Yeah.
Where is that, where are you getting that?
But I guess
Just clean
everyone
up
needs to
as
start
active
thinking
duty.
about
Top of the first or
how
second page.
important online
Top of the
versus
second
in
page.
person
It
is.
says allowed.
Shall require at least,
At least half.
which means it could be more than that.
Must be allowed,
Must- yeah.
so that you could,
Well, it says at least half must be allowed.
But there's no other rule on
But
that.
there's not, the board has never made another rule about that.
Because to me, I read that says we have to allow them to do 20 hours.
Yeah, at
Minimum of,
least.
minimum.
At a minimum.
Could be,
but we've never
there is no
set,
maximum.
we've never set
A
a
max.
top. Like, they.
And the
So
only
what-
other thing we
So what
have-
you're telling me is that word should say maximum, not minimum.
Right.
If
Right.
we.
If we
want
wanted
If
to
that's
limit
what
it,
to be.
But
but that's a discussion we can have when we redo the rules
But
on
as far
C.
as what you're confronted with now,
Mhm.
I think you have to allow them.
I mean, this recent period that we're evaluating for 21 to 23, pretty much, COVID was pretty much over. When did the CRVC Crossroads Conference start back up from COVID?
We never stopped. Well, no,
Yeah, we did.
20,
We had one
Which
year.
one? 21.
Was
21.
COVID was over, but I don't think video conferencing has gone away at all.
No,
No.
but what I'm
Yeah,
saying
you're
is
right.
from the,
Or in person, a meeting.
an argument could be made if there was no Indiana live meeting in 2021.
Right.
2022, which would help a person's case that said, look, I couldn't go to a meeting if I wanted to.
Do we know that?
22 and 23, there were 21. I'd say 20 was distance, was online. I think 21, we started back live.
I guess what I'm saying is, but
'Cause
post
this-
that, I think a lot of people just had the
Continue.
expectation that whether it's offered in person or online, I can do what works best. And we don't have a statute that tells them otherwise, so.
But
I
this,
think I'm
this
calling
renewal
Lisa right
period
now.
that she's auditing right now is from 21 to 23.
I know, and I'm saying that they probably had an option for in-person, but they didn't want to take it because they also had the other option. And we don't have a statute that would, at this point, determine, so like if they wanted to choose, if you don't want to drive up to Indy, then you're not going to, or wherever it is.
Well, the other thing
Lisa,
is,
this Josh
we
there.
have,
You give me a call on my cell phone, 317-408. Lisa, call Schneier, 317-408-7261. Thank you.
I think we can probably.
I
all
think,
agree
the
that
longer
it's
I
too
think
messy
about
right
this,
yeah,
in
Has to be
20,
accepted.
There are some
One,
people that I'm
I
failing.
think we had.
For what?
Okay, so I just reviewed one yesterday. They got the notice for CE, which they got really early this year. And, of course, they had to have it done by October 15th, 2023. She did all her CE after that. And then turned it in.
Right, but so like the in-person versus that, you're not failing anyone for
No.
this go around, because we haven't clearly defined it.
Well, I've got them all in this box. So those are the people that I was just like, I don't know. But anyway, or like the, what was the one I told you, Indiana Vet Hospital or?
By the way, is BCA the worst ever?
Actually, I think what we ought to do with IndyVet.
I always
we
laugh,
ought to tell them,
for 8 years now, anytime anyone
send
comes
your
in here, they're
dang on
questionable. It's
I
like,
think
we're
they're good
BCA.
CE, IndyVet. But what they
Yeah, I
need to
know.
do is send us,
There are some very.
so we, you know, at our meetings, we can approve all this stuff.
Yeah, they've never applied for CE through us and they're not race approved. If it's race approved, then I'm letting it go through, but I don't have anything from them. And so that's where I'm struggling, but it's only been like 1 or 2 people that have used IndyVet. So
Actually, I think.
oh, there it is, right there.
I don't really want
The
to.
CE, the chairman of the CE committee of the Indiana Veterinary Medical Association happens to work for IndyVet, so I think.
Oh, really? Mind you, with CE, we approve it for, as it pertains to this, right? That's why every once in a while,
Yeah.
she brings something and say, is this approved?
Right.
Mhm.
Right.
So
And
the
then
bottom
it's-
line is, we really cannot instruct you to ding or penalize people for having the majority of their CE virtually or online.
Or like someone has it all distance
What you're
ed.
telling us is we don't have any legal leverage there.
I don't think so, not right now.
I would agree with you.
So
I
something
think
to
what
think about
we
is,
need,
do you want to mandate how much? Or not?
I would say it needs to be cleaned up in some respect, but
I actually will be coming to the board with a recommendation in April because I have a report from AAVSB where the same exact question was asked. How is CE, what are the rules for CE in your state? Some states have absolutely no rule other than you have to complete 40 hours. We don't care how you get them. They have to be either race approved or approved by us, and it has to be 40 hours. Other states, like Kentucky, make it incredibly complicated. And I think just the easier the better. You know, I don't think the Indiana bar or the Supreme Court ever went back to, oh, so much has to be live, so much has to be distance ed, because I went to their website and I never saw a change. So I think there's this movement, at least in most professions, to, we don't care how you get it, because most of the CE online, at least, you have to keep pressing that you're in attendance, you're watching, or you have to take something afterwards.
That mouse wiggler?
Yeah. Do we trust you? Well, attorneys, they make you keep clicking. Like, are you still there?
I went to one national AVMA meeting
Mhm.
and you had to sign in, and then it got all high tech where your badge had a,
RFID.
remember that, RFID,
Well,
and you
that
walked into the room, you were already
That
checked
was-
into that.
that-
What if you just left your badge on the chair?
Texas is.
And I don't want to get to the point where we have to get to that much documentation. I think that's going on.
I pulled up with
Eyeball reading.
Texas is one of the first states to do that. Their attendees had to have a special badge to go in to know.
IndyVet, I pulled up an old email that came and the headline, on lots of CE updates from IndyVet, and then it's, what they say, free in-person and virtual CE lecture. Doesn't say who is, it tells you who's speaking and what it's on, whatnot. Doesn't say who, like race approved or whatnot. I'm looking to see if anyone.
But they're issuing certificates. Though, right?
Yeah.
You must attend live lectures to receive your certificate.
Is that across the board?
This
Like
is
for every
this
one
is
of those?
IndyVet saying, this was
Okay.
just the one I pulled up to say.
Well, you know.
I mean, I can tell you, I've done some drug company sponsored things, whether it's Zoetis or Boehringer.
Yeah, yeah.
Whatever.
I've seen
And-
Zoetis
And,
ones.
and that's an interactive webinar in
Mhm.
that you can send questions,
Yes.
but your speaker's muted. You can't ask a live question
Right.
on the speaker. They're given their spiel, and then at the end, they'll pick the top 10 questions and answer them for you. So it's interactive in that standpoint. I can tell you, though, it is quite easy to initiate that program and go into the other room and watch Law and Order and come back with 10 minutes to go. and
But it
sign
is
out.
at a Purdue CE too.
But you can do it that way. It can be done.
Yeah.
I mean,
CIVMA has the same thing. We have,
And at the
Jackie,
IVMA
we had a
meeting
board-
next week, I can
You're
go in there.
swearing like at the Purdue conference that the ones they check mark, they give me their
Right.
thing and they check this, and I attended these and I can't argue that.
Well,
Purdue
yeah,
doesn't
as
get
far
the
as I'm
separate
concerned,
The
certificate.
IVMA does the same thing.
Yeah.
Next week's meeting, we're gonna have a sheet. We're gonna check off what meetings we
Right.
went to. It's strictly the honor system.
It,
Indiana's always been that.
the only thing that's not
I don't know
honor
who else
is
did it.
renewing your USDA.
Right.
you're also attesting when you renew that you did complete your CE.
Right.
And then you did it in accordance with the law. So if the law's changed and we just say, you know what, do your 40 hours, you know, if you get audited, you have to show proof. And then we find out that people have been somehow skirting the system or whatever, then they get hauled in front of this board and they can be fined and, you know, the fines that they talk about in the statute up to $1,000, that can get pretty hefty if they start lying to the board about completing their CE or making up certificates or that RVT. I mean, that
Yeah.
certificate looked real. I mean, you could tell where Indiana was a little bit off, to be honest. But, I mean, when I'm going through those documents as quick as I am, I mean, Gary saw how many I had after Christmas, a whole box full.
I got approached by, I think it's Teresa Lulai. She's not one of those, they're having, because she asked me just last month. She sent it all in. She said she got all of her certificates. She just got them into you. But she hadn't heard anything and she's all worried.
Oh, I sent out 60 successful CE audit completion letters yesterday, 60. So people gotta be patient, I'm a one-man show.
And you have how many?
233.
Do they know if they're being audited? Do they get a?
They get a letter,
then
and they're not even all due yet. They're not due till the end of January. I have most of them, like I said, I've
they
reviewed
don't
and
have to
completed
turn in
70% of them, so.
Oh, so the rest of the time you're just gambling?
Not
Yes.
all 2,000.
I will give you
It's a lot of
that.
10% a year.
This is the first time
Have you been
in
audited?
almost 8 years I've been on this board that we've ever heard, you know, IPL, ELI, whatever it was, ELI, they never, you know, we never got any, they didn't care, you know, I don't know how they audited or what they did or anything, but we never heard anything. Have you ever heard anything from PLA? Whatever the hell.
I think we had, you know, a handful in 13 years of practitioners that were told you're short hours. And then as a board, we would vote to give them an extension in time so they could complete it. We did that not all that long ago for an
Yeah.
older veterinarian that had some health issues or whatever. And if you remember right, he went ahead and got like 30 hours in 3 weeks' time.
I do remember that.
That was a
Remember that?
reissue or something, that wasn't it? It wasn't
So-
just that he was short, it wasn't on a
Yeah,
It
he
was
had
something-
like come out of retirement.
Yeah, there was something
and then-
Came out of
It
retirement.
wasn't
was
just
like
that he-
way-
And it was a renewal,
Because
and he hadn't done any CE, and he got it all done in 2 weeks.
Cause I think we had.
So if somebody's like a 0.5 hours short, like they send it in and they usually send me this nice little note, or they have a whole chart and it totals 40. I still go through it all and I had my husband count this one because I was like, I can't be counting this wrong. They're 0.5 hours short.
Yeah, I think you gotta let that go.
One more question.
But then.
Then you get to the hour short.
Do you make an earmark and say, well, you can we want 40 hours, but if you're 5 hours short, we're gonna let you slide. You can't really do that.
Right.
I understand it.
So where do I draw the line?
Did you reach back out? Was there a mistake?
I haven't reached out yet. These were the discussions I wanted to have.
I know, this is,
I can
I
send,
was like,
I can
did
send
you,
you.
did you accidentally write
So you can see how
something incorrectly, or you really only had?
I was gonna make a joke.
And I would probably stop.
You know, there's so
But,
many
you know,
jokes you can make
Yeah,
with the funeral
Or
board.
you just send them 15
Common
Yeah.
sense and say a half an hour is sort of hard to
round up.
find somebody at $1,000 for being a half hour short.
Well,
He was just saying sometimes he's done more, but has only submitted, so maybe they have another hour they could submit. But
I was saying, why don't they go to these big I know they're expensive, but really, big conferences, knock all the hours out and you're done.
Hey, if you're gonna go to BMX, that's in Orlando, Florida. There's other things to do besides sit in a room.
Hey, one other question on, so the 20-hour thing, we'll figure out one day. Where, as far as our controlled substance, we have to have the two, where is that come into play as far as, where is that written out? Who's?
It's required for your CSR. It also counts for your veterinary license.
So it's not required for our 40 hours for our veterinary license, only for our CSR, is that what you're saying?
Yes,
Okay,
but if you wanted to count
sure.
for your 40, it
Well,
can.
it better count because I used it.
Yeah.
But an Excel study through the IVMA, you read
Yeah,
you read it and you send I think in my case, old fashioned, I faxed the answer sheets to Lourdes and she sent me the certificate.
yeah, he faxed the complaint about to Brittany.
It's easy to go by the clinic.
And then she's like, do you have a fax machine? I said, a fax machine? I said, here at BOA? If we did, I don't know where it's at.
I remember Dr. Marsh getting all excited that there was more and more large animal practitioners for health certificates that actually had a fax machine, you know? I mean, there was a point in time where it was like, you know, times are changing and you're
They
100% right.
Well, I wanted to know if you wanted me to get a quill or something to take my notes with.
You're not recording all this, correct? Or are you?
Yeah.
no, we're still on.
Okay, so we're still recording, so I think we should make a motion to adjourn. Unless there's further discussion.
Laura, real quick, do you need any additional input from the board on when to issue a fine versus, and then how much of a fine versus some other, if
I
you
don't
fall
issue-
short,
I don't issue those, Gary.
bring it to the board?
Mhm.
Okay.
It's
So-
all on them. I just,
So she would have to, at one point, when she's done with this audit,
they're sent
present
notice
to
of a
us,
failure.
we have, let's say she takes this, we have these 5 cases that are egregious, then we have to make a decision on it,
Yes,
correct?
yeah, so it's their decision.
And will those people have to appear?
Mm-hmm. And in the past, what I've seen is you guys either withhold the fine, or if it's egregious enough, you might give a $500 fine. And then you make them make up the hours within so much of a time frame.
Right, that's what.
And it doesn't count towards the new 23 to 25 audit.
I mean, we've only had to do that maybe, I could count on one hand in 13 years, you know, only a few times where we had to do that. But to
that
Laura's
answer your
point
question?
and to John's point, I don't know how closely those were scrutinized by IPLA staff.
Remind me, my green folder stays.
They're first separated, then
So
they're
we want to make a motion,
I'm taking
I move
motion to adjourn the meeting.
Oh, I need to write this down.
those in favor say aye.
Aye.